20th, 2021 Board of County Commissioners meeting. We'll start with the agenda item 1A, roll call. Will the clerk please call the roll?
Commissioner Bernard,
Here.
Mayor Kerner,
Here.
Commissioner Marino,
Here.
Commissioner McKinley, Commissioner Sacks, Vice Mayor Weinroth,
Here.
Commissioner Weiss.
Here.
Very good. We do have a quorum with all 7 county commissioners present. We'll move now to agenda item 1B and C, which will be the invocation and pledge of allegiance led by Vice Mayor Weinroth. Please rise.
Thank you, Mayor. Dear God, we are meeting today to conduct matters of business for our community. Guide our hearts and our minds in a spirit of fairness. Impart your wisdom upon our activities so that our affairs may reach a successful conclusion. Thank you for being our source of guidance today. Amen.
Indivisible, with liberty and justice for all.
Thank you, Vice Mayor. We'll move now to agenda item 2A, additions, deletions, and substitutions. I'd like to recognize our County Administrator, Ms. Virginia Baker.
Mayor, members of the board, we have one addition, deletion, and substitution, page 33, 5B2. It's a revised summary. April 6th was changed to April 20th. That concludes the add, delete sheet.
Very good. Is there a motion?
Move adoption.
Vice Mayor Weinroth has moved adoption. It's been seconded by Commissioner Weiss. All in favor, all opposed, the agenda has been adopted as amended. We'll move now to agenda item 3, which is the consent agenda, and I'll start with my colleagues on the board. Is there any member of the board that would like to pull any item from the consent agenda? Very good. I'll turn it now over to Commissioner Bernard for public comment.
Thank you, Mr. Mayor. We do have Bonnie Hodges Leach on item 3DD1.
Thank you, ma'am, for joining us today. You'll have 3 minutes to make comments on that item. You're recognized.
Good morning, everyone. I'm so happy to be here. I want to talk about being grateful. Grateful that I've been given another chance to make a difference in the community of Sandcastle. I'm grateful that I could walk up here because I broke my ankle in 2 places in January. But I'm here, and I said I was going to walk, and I have. And, life can be very difficult for everybody. But being grateful for what you have right now, forget about what you lost last year. It's a new year. It's I don't want to get too far into not thanking people, which I usually do. I want to thank the backing and the constant allowing me to grow with them, which is OCR, Office of Community Revitalization, Houston, Vivian, Ruth. Let's not forget Audley, Scott, and William that have been physically out there putting food on trucks, bringing food to Sandcastle. I've just been given so many blessings. From last year, that was nothing. It was all blessings. Hard times, yes, but blessings were twofold, tenfold. And I just want to thank everybody here that Sandcastle is changing, and it's because of the hard work of the people that support me and you commissioners in allowing me to do more work in my community. So, I do want to thank also PBSO, District 6 and District 3. We could not do it without you. I love you all. Thank you.
Very well said. Thank you for those very kind and meaningful words, and we recognize the hard work of everyone that's been involved, including the District Commissioner, Commissioner Marino. Right?
No, District
3 or
No, District 7.
District 7?
Yes.
Commissioner Bernard. Sorry, the PBSO districts got me messed up a little bit. Any further comments by members of the board, or is there a motion?
Move adoption.
The motion by Vice Mayor Weinroth, seconded by Commissioner Weiss on the consent agenda. There's no further public comment. All in favor? All opposed? That item passes 7-0. We'll move now to special presentations, and as always, we're delighted to have with us the Director of the Department of Health. Oh, special presentation. Sorry, let me get to page 32 and do it in order. 4A, proclamation honoring the life and career of Congressman Alcee Hastings, District 7. Commissioner Bernard.
Good morning. I want to thank everybody for being here today, the Board of County Commissioners and the Mayor, and especially Dr. Alcee Hastings II, who's going to appear virtually. And I would like to extend my condolences once again to the family, constituents, and friends of the late Congressman Alcee Lamar Hastings. This proclamation honoring the life and career of Congressman Alcee Lamar Hastings. Whereas Alcee Lamar Hastings was born on September 5th, 1936, to Julius C. Hastings, a butler, and Mildred L. Hastings, a maid, in Altamont Springs, Florida. And whereas at the urging of his mother, he graduated from Fisk University in 1958 with a bachelor's degree in botany and zoology. And after deciding against a career in science, he started law school at Howard University Law School before transferring to Florida A&M Law School and graduating in 1963. Whereas, after earning his law degree, he went into private practice and joined with law partner W. George Allen, quickly becoming known as a prodigious, charismatic, and successful civil rights lawyer, frequently taking on civil rights cases pro bono, filing lawsuits aimed at ending segregation in hotels and restaurants and desegregating Broward County schools. And whereas Alcee Hastings made an unsuccessful bid for the United States Senate in 1970 as the first African American to run for statewide office, and he was quoted as saying, "I think I will prove to blacks and whites alike that a Negro candidate can be just as seriously concerned with taxation, with saving our environment, with providing rapid transportation, and with helpful programs for our senior citizens as any white candidate is." And whereas in 1977, Florida Governor Reuben Askew appointed him as a Broward County judge, and he was sworn in at a high school he helped desegregate 2 years later. 2 years later, United States President Jimmy Carter appointed him as the first African-American judge on the United States District Court for the Southern District of Florida. And whereas in 1992, he was elected to the U.S. Congress as the representative for the 23rd District, one of the first African-American members of Congress elected in Florida. And whereas Alcee Hastings was elected to serve 15 terms in the United States House of Representatives, representing Palm Beach County and South Florida, rising to hold senior posts on the House Rules Committee, and upon his death, serving as the Dean of the Florida Congressional Delegation as the longest tenured member. Whereas Alcee Hastings serving as House Chairman of the Helsinki Commission for 2 terms, was said to develop the most diverse professional staff on the Helsinki Commission in its history, pioneering initiatives to improve the recruitment of minorities and women in the intelligence community, and supporting the USAID Donald M. Payne Fellowship focused on minorities in development careers. And whereas Alcee Hastings served as mentor to many, both young and old, in his congressional office and throughout his community, and is responsible for countless numbers of African American men and women ascending to leadership positions. And whereas throughout his career, Alcee Hastings worked tirelessly against racial injustice and was a champion for the LGBTQ community, immigrants, women, and the elderly, minorities, better access to health care, higher wages, and the state of Israel. And whereas Alcee Hastings was a steadfast advocate to his constituents in Palm Beach County, offering assistance to those in need of federal services and those facing difficult circumstances. And whereas Alcee Hastings was a servant and ardent supporter of the Glades community, recognizing not only the economic importance of agriculture, but the socioeconomic needs of those who labored in the industry and infrastructure demands of the communities that supported the industry. And whereas never at a loss for words or a smile, Alcee Hastings lit up a room upon his entry, greeted everyone he met as a lifelong friend, and with his naturally fiery and dynamic speaking presence, unintentionally subjected anyone who spoke after him to abject disappointment. That was me also. And whereas Alcee Hastings' survivors include his wife, Patricia Williams, 3 adult children from previous marriages, Dr. Alcee Hastings II, Chelsea Hastings, and Leah Hastings, and a stepdaughter, Maisha. Now therefore be it proclaimed by the Board of County Commissioners of Palm Beach County, Florida, assembled in regular session this 20th day of April 2021 in Palm Beach County, that the board is hereby honoring the life and career of our Congressman Alcee Hastings. Thank you. And now we'll recognize Dr. Alcee Hastings II.
Thank you so much. Is everybody able to hear me? Hello. Hi. It looks like on the tape. I am so humbled and honored by the fact that Commissioner McBernard and the mayor and alike, that you all are recognizing my dad's illustrious career. I am appreciative of that fact. I am traveling in DC. Ironically enough, they're doing some memorial services for my dad tomorrow, but I'm so appreciative and deeply humbled by the fact that you recognize my dad. He wasn't only just a congressman to me, but I appreciate and honored and respected so much that he did for others. But we were truthfully friends, and I'm gonna miss him dearly. But the fact that you recognize him in this regard is such an appreciative dynamic for me and my family, and I'm so thankful of that. And I appreciate you all for such a touching and kind memorial and proclamation to my dad. And thank you again, Commissioner McBernard, for that honor. Thank you so much.
Dr. Hastings, on behalf of the board, I don't think I can say it better than Commissioner Bernard's proclamation, but while we celebrate the life of your father, we also pray for you and your family in your time of loss, and thank you for joining us here today, sir.
Thank you. And you all keep up the great work. I follow you from a distance. I live in Broward County, but I'm very appreciative. And you do so well in Palm Beach County that I think I want to move there eventually. So keep up the great work.
We're delighted to have you, sir.
All right.
Thank you.
Thank you so much.
And be safe in DC.
I'm
Thank
gonna
you for
log
your time.
off. Thank you. I appreciate everybody.
Yes, sir.
Thank you, Mayor. Thank you.
Very good. Thank you, Commissioner Bernard, for that proclamation. Were there any other comments by members of the board? Commissioner McKinley, you recognize, ma'am.
Commissioner Bernard, thank you so much for that recognition and also for making sure that you included the Glades community in your comments. I think people so associate Congressman Hastings with Broward County that they forget how far west he actually represents. And I told the story at our last meeting about how he always talked about how his parents sent him down to his grandparents' house and he picked green beans in Pahokee, and that was one of his favorite stories. But shortly, and I feared speaking after him as well, but shortly after being elected, the first National Association of Counties conference I went to was in Washington. And during that meeting, the Everglades caucus met, and Congressman Hastings, along with Congressman Mario Diaz-Balart, were the co-chairs of that caucus. And I remember walking into that meeting room in the Capitol and being completely overwhelmed that I actually got to sit at the table. And I remember Congressman Hastings coming up to me, and I didn't really know everybody in the room, but he came up to me and he said, "You belong here, and I'm glad you're here." So that's how I'll remember him. Thank you.
Very good. I know we all share special stories in our hearts about Congressman Hastings. I was always in awe when he would speak to our various Democratic clubs as we're always out and about back before COVID. And I always felt bad for the member of Congress that had to follow after his speech, and for Commissioner Bernard as well, apparently. Very good. We'll move now to agenda item 4B, which is COVID-19 update by Dr. Alonso, and I do think we also have the CEO of the Healthcare District, Ms. Darcy Davis, who's been a stalwart partner, and our emergency manager of Palm Beach County. And I think that that would be the whole lineup. Mary Blakeney, not Michelle. And who would like to kick it off, Doc? All right. Well, you are recognized, ma'am.
Thank you very much, Mayor. Good morning, Commissioners, County Administrator, morning. So here we go. We're ready to bring this on one more time. So I'll start with our numbers. As you can see, have increased a bit. I'm showing you the one from our last meeting on the 6th, and then today we have another 1 million cases in the U.S. and 12,000 more deaths. The deaths are a little bit higher, but pretty even. What we do see is a little more significant in terms of the number of cases. When I came in to one of the board meetings back in the end of February, I mentioned that I was concerned about these two little peaks that had just occurred on the national curve. That started worrying people because the numbers had been coming steadily down in a very steep curve, and all of a sudden we had a bump. And so we said, you know, it's just a little bump, but we got to watch that. As that has continued, as you can see here, you see that these numbers now are higher than back in October and July when we had our second peak, and obviously the large peak that we had here back in January. So just look at those numbers and see how we've gone. Nationally, the cases in the U.S. have gone up about 4%, and the deaths, though, are down. So this is the dichotomy that we're having right now of cases going up, deaths going down. We'll take a look at why that's happening. As far as our cases, and we have a map by the CDC. This is on the CDC website. I have the website there, so I'm not plagiarizing. And we can see that there's a map that shows the cases rate per 100,000 population, which is very important because it takes away the issue of the number of people. And what we see is that while Florida is at a 100 cases per 100,000 in the last 7 days of about 204, Michigan, which is having a terrible surge right now, is more than double that amount at about 485 per 100,000. That's very significant. The other blue states are all in the middle of the 250, 260 numbers. So that's very important to keep in mind. In terms of our numbers for the cases in Florida and Palm Beach County, Mary will be able to add more details to that, but right now all our indicators are in the red, going up. In terms of our vaccination, we continue to lead as a metro county. We're up to the 80%. I think at our last press conference, we said we were going to be hitting that 80% very soon. And you can see that in the other numbers, we're also very close to the other metros. So we're all keeping pace, and this is very important. Across America, more than 33 million vaccine doses are being administered on an average daily. But a sudden pause in the Johnson & Johnson vaccinations forced many providers to cancel appointments. We had cancellations here. This is an issue that for some is seen as transparency and taking caution and abundance of care, while for others, this hesitancy is one more issue that they have to consider before getting vaccinated. As you can see, Palm Beach County leads in the vaccinations of seniors and very close in all the other areas. So our vaccinations are continuing to go up, both in Palm Beach County as well as the state and in the nation. That is a very good thing. So that's one of the things that we want to do, is to continue vaccinating, because we have to get all those other groups vaccinated if we're going to succeed and fight this upward curve that we're seeing in case of increased cases. Now, the variant is another issue that, whoops, I gotta go to the next one, that folks are worried about. This is the map from our last meeting, and we saw that we had basically, I showed you the numbers for Michigan, Florida, Colorado, and California, who are now turned blue. If you see, Florida had 3,568. Michigan was just at 1,242. So Florida continues to lead in terms of variants, but look how many more states we have now. So the variants are increasing in numbers and expanding from 6 states to now 10 states. We have 5,785. We have all of the variants here in Florida. Michigan leads in second place with 2,277. And then you see the rest of the Minnesota, Colorado, California, and Georgia at 1,000. And then Tennessee, Pennsylvania, Connecticut, and Massachusetts has 1,000, but the rest of these have 800, right? These down here. So it's interesting, right? Because even though Michigan has this huge surge, including hospital surge, and they're really in bad shape, a lot of them have blamed it on the variant because it's more contagious and it's spreading more rapidly. However, we're not seeing that in Florida. We have more than Michigan, and yet we're not in the same situation as Michigan. So it's just interesting. The numbers in terms of Palm Beach County, Broward, and Dade continue to be in the same proportion, with Broward leading over 1,000, Dade at 719, and we're 448. And again, we have all of the different South Africa, the Brazil/Japan, the 2 from the U.S., from California, and then the 1 from the U.K., which is the large one that is in the blue, which is the largest number of cases. So where does that put us? Well, we're now definitely entrenched here in phase 3 finally. And what does that mean? There's free-flowing vaccine. The private sector is ordering and obtaining vaccine. The entire population has access to the vaccine except for children under the age of 16 for now. Studies are being done to be able to vaccinate them, and I think soon they will be able to be vaccinated. And there are open and closed pods throughout our county. And the availability of the vaccine is widely available at this time. As a matter of fact, we continue to see the number of vaccinations going up, and yet for the healthcare district and for us, there's a little bit less people coming to us because they can get the vaccine in other locations. Some of our appointments are being canceled because the public has access from other sites. And that is something that we want to happen. That is a good thing. So the plan now calls for the objectives that were written here from the very beginning. This slide has not changed since the first day that we put it up. We kind of created this little graph way back when we created the COVID plan for reopening, long time ago, right, Mary? And so now we're in this upper left corner, and which we've shown since our first presentation. So the emergency response team transforms back to doing their original work. However, we still have one very hard task in front of us: how to stop the increase in cases and how to get more minorities and other hesitant individuals vaccinated to be able to reach herd immunity. That's the national objective, and that's been our objective, to stop the spread of the virus first. by testing and by doing contact tracing to stop the spread, the use of the mask, that was our only tool. Now we have the vaccine, so we have a second tool. And I will also say we have a third tool because now we actually have something that can treat the virus, which is the antibody monoclonal therapy that's actually available to treat people who get the virus, but it's not widely utilized or widely known. So this is something that we have to get out, and we're working with the Medical Society to first start educating the physicians on what it is and how it should be used, because it can actually stop someone from going to the hospital and recover much more quickly. So it's actually a cost-saving therapy that should be utilized and is very underutilized. The other issue that we have that's very, very important is to be able to get to who's creating the cases. I've repeated this several times. Here it is one more time. We're now showing that the age that 15 to 44 is 51% of the new cases that we see here. Is that me or you? I don't want to talk to you. Go away. Sorry, I forgot to turn the phones off. So we see here, all right, the 51%, and if we include the up to the 54, then we have another 20%. So almost 70% is just in this category. But I want to concentrate on just this 15 to 44, okay, because that's the largest group of cases. However, the deaths, which occur, 85% of the deaths occur in the 65 to 85, which is this number of how many are deaths. But look at the new cases. Only 8% of the new cases are in that age group. So that explains the reason that we have increased cases, right, in this group, but decreased deaths. And that's a national trend that's occurring throughout the country, through the state of Florida, through many other states, as well as here in Palm Beach County. So the most important thing right now is to get this message to the 15 to 44-year-olds that stopping COVID is really in their hands. It is this group, most importantly, that needs to get vaccinated now that we've taken care of the seniors. We've taken care of the people that are going to die. Now we got to take care of the ones that are spreading the disease. We also want to make the message and that we are finding more and more long-term consequences of the COVID infection. These long-term conditions are often more severe and debilitating than the infectious period that they had with the COVID when they caught it and wasn't a big deal. They're having migraines, they're having neurological issues, different organs are being affected, and this is something we're going to learn more and more as we study this COVID virus. It's really definitely not just the flu. It has consequences, and it may have lifelong consequences. So this is very important that we get this message to this group so that they understand and they take this as their own calling to stop the spread and challenge each other to get vaccinated. So kind of in closing, how do we go forward now that we're in this phase 3? The number one objective is to stop the spread of the COVID. That continues to be an objective. We want to avoid loss of lives. We don't want to have a hospital surge, and we don't want to have to go back to closing schools or businesses or anything like that. I don't think anybody can swallow that one. Right now in Michigan, even though they've been told to do that, they have not been able to close those businesses. Wearing masks stops the spread of the virus, including the variants. We know that. We had a very low flu season, so if anybody wants to argue about masks, I'm not going to be able to convince them otherwise, but we have plenty of examples to show that the mask works, and that is something we need to keep in place. We need our daily positivity numbers to be below 5 to 2%, like they were at one time, and our total positivity to be below 10 to be safe to be able to go out without masks. It has nothing to do with the number of cases we have, and it has nothing to do with, a lot of these indicators. What matters is how much virus is in the community. That's when we can take these off, and it probably will not be for a long time. with the vaccination of the 65-year-olds and the seniors being vaccinated, it is not likely that our hospitals will surge here in Palm Beach County. The focus attention needs to be to assure that the congregate living facilities, including jails and schools, are continue to test and continue to vaccinate and treating with life-saving antibody monoclonal therapy. We will be prioritizing our contact tracing to look at outbreaks in those facilities as opposed to just looking at individual cases that occur. As we enter phase 3, we begin to plan to transfer the vaccinating to the private sector. The pharmacies, the Walmarts, the Walgreens, the clubs, all these large private sectors will be doing the vaccines just like they do every year for the flu vaccine and other vaccinations. And people appreciate going to those places where they shop to get vaccinated. We need to focus then on 2 specific groups as we enter phase 3. One, the one that I mentioned, the 15 to 44-year-olds, especially in college and universities. We're going to be working very close to do pods at universities and help them provide vaccination to their students, and also transition from mass vaccination to targeted community groups consisting of minorities, which are the hardest hit in terms of mortality and morbidity, and other hesitancy groups that, for example, the 15 to 44-year-olds. We need to target that specifically so that we can get those cases down and go into the hard-hit areas and the underserved areas. So with that, I conclude. Continue to wear your mask, wash your hands, watch your distance, and stay tuned for this new phase that we're in, slowly getting out of the emergency and going into a more normal vaccinating phase as we go forward. Thank you.
Very good. Thank you, Doctor. I know we'll have some questions for you, but we'll continue down the line to CEO of the Healthcare District, who's been an incredible partner both in testing and vaccination process, Ms. Darcy Davis.
Thank you. Good morning. I have a presentation to talk about prioritizing resources, so hopefully I can get that queued up and I can. All right. Here we go. So in line with what Dr. Alonso said, here we are in phase 3, and what does that mean for public resources, our resources? The first is just to give you a visual of the timeline of our efforts as our vaccination efforts matured. You can see we received our very first vaccine December 23rd, and that was started with vaccinating our employees. We at the Healthcare District are now at a 60% vaccination rate. But early on, before the mass sites were mobilized, we had outreach in Belglade, at Lakeside. We were also doing mobile clinic outreach in targeted communities. We went to St. George's and the Jewish Community Center, Leisureville. You may recall some of those efforts as we were preparing to go on a mass scale. We also had walk up at our West Palm Beach C.L. Brumbach Primary Care Clinic. And then, of course, we started at the South County Civic Center, Fairgrounds, and North County, where we are today. And thus far, we've provided over 160,000 vaccines through all of these efforts combined. So for us, phase 3, this looks similar, but this is the Healthcare District response. So in phase 1, we mobilized and took on a crisis response. Phase 2, we've got a foot in each side here, so we're still operating at the mass sites. We're trying to get the mobile units out and also have incorporated the vaccine into our primary care locations where we're vaccinating our patients. So we are in phase 3 here, and that's where we see our role as that safety net with our mobile vaccination units becoming a lot more active in the community. So just in terms of what that means, in terms of the vaccine itself, when there's very little access, very little supply, and high demand. That is that definition of that crisis response. And, walking you forward to phase 3, as access has expanded, supply has saturated the community. It's not so much that demand has decreased, but it's more or less that the supply and the access are now outpacing the demand. So that when I will show you for us particularly in just a moment is what that demand means for our sites. So where are we now? Vaccination specifically. So in terms of access, so this I think is not an unfamiliar slide. In fact, I think Mayor, I may have taken this from you at the last press conference with the latest known locations, 67 Publix, 57 Walgreens, and so on. But there's also a number of providers, including, approximately 93 is the visibility that we had, that include physician offices, urgent care centers, federally qualified health centers, and so on. They're now able to access, private providers are now able to access the vaccine directly, so we don't really have visibility on how many there are and where they're going specifically, but also hospitals, some of those open pods, the mobile unit, and so on. The picture to the right is on the website, Palm Beach County website, and it's not a complete, actually doesn't have a complete listing of all the sites because, as I said, not all are completely known. In terms of supply, this is actually a national phenomenon. When we look at the increased supply, that you can see that the supply for Pfizer and Moderna specifically is significantly outpacing the administration of the vaccine. But what we also know in terms of supply in our community is that capacity exists at a number of those public access points. We've all heard on the news that the CVS and that the Publix, that there's very little wait time. They've expanded hours. They're trying to reach out and get additional people to take advantage of the vaccine that they have. So for the healthcare district, so as we can look at this from a lot of different directions, we started at that highest level in terms of interest. So when you look at the hits to our website, just for example, where someone would go to register, the top graph represents the, from the beginning of February over time through April 18th, and you can see some of the peaks and valleys, and then the lower graph is just this past week. The interest and the hits to our website have declined significantly. A little spike on the 15th when we opened up 16,000 appointments, but then it quickly tapered off. This graph here shows you really the red line is what you see in terms of unfilled appointments. We expected that as the eligibility expanded, that we would see a proportionate increase in demand, and that did not happen. In fact, today, when we opened up the 16,000 appointments, we still have close to 10,000 that are unfilled as of today. And today, we're operating at North County and South County, as example, at 50% of capacity. So we didn't fill all the appointments that we had today, and that carries on throughout the rest of the availability we have here. Just the grays, the light gray represents the capacity, the dark gray, the vaccine administered, just to give you a sense of what you're looking at. And then that red line is that trend line over time. No-shows and cancellations. So it's not just that we have unfilled appointments, we also have a rising trend in terms of no-shows and cancellations. You can see here the absolute number, but what we used to see is maybe 10 to 12% in terms of a rate of no-show cancellation each day. Now we're seeing somewhere between 25 and 30%. In addition to the unfilled, the ones that are being filled, we're seeing no-shows and cancellations going up as well. So what am I telling you? So in terms of the decreased traffic, the unfilled appointments going up, no-shows trending up. We didn't see the demand that we thought we would see. We also have some other soft indicators. So, one of the things that everybody measures is that it used to take a few hours and people would sit on our scheduler and just wait in line until, they were alerted that an appointment was open. There's no wait. People go immediately in at this point and can book, that's another soft indicator. And then also this duplication. So our team spends a lot of time each day when somebody will go in and schedule themselves for multiple locations, multiple times. They're more or less shopping to see what's convenient. We go in and have to clean that up and then free up an open appointment. But it shows a little bit more about vaccine shopping. So again, it's more of a soft indicator of what's happening, but I just wanted to share that. So what are we saying? What we're saying is that I think our resources could be better used now going out into our community and targeting some of those hesitant populations with our mobile units. So we still have open appointments that we are committed to April 22nd through April 22nd in North County, April 24th in South County, the fairgrounds through May 6th. That's another 16,380 appointments that we have available currently, with about 10,000 still of those unfilled. And the reason I bring it to you as first doses and second doses is because most of what we're doing at this point is Pfizer. And of course, when we say this is the last first dose, 21 days later, we still have to do all the second doses. So it's really a 2-month, wind down, so to speak. And we have sufficient supply of vaccine currently to accomplish this and then some, not including, any Johnson & Johnson that we would have sequestered elsewhere. This is just Pfizer and Moderna. We currently have 3 mobile units, thanks to the county's support of us during testing time as well. And those mobile units can do as much as 500 doses per day per unit. We can go into communities. We don't need appointments. It can be walk-up. We're trying to make it convenient, but also a smarter, more targeted approach to get to those communities where we know that they have trust in either a faith leader or their medical team. So, our physicians and our clinical teams that have relationships in some of these communities have a higher trust level. I think it makes more sense for our team to go to them now versus waiting and trying to campaign for them to come to us. So that is where we are, and that's the end of my presentation, and I know Mary has some information, then I can answer more questions.
Very good. Thank you for a wonderful presentation. And we'll turn now to our emergency manager for Palm Beach County, Mary Blakeney.
Good morning, Mayor, Vice Mayor, Commissioners, Administrator Baker. Good morning on this 400th day of our EOC activation due to COVID-19. I'm going to present to you our phase restart program indicators. As you will see on the information that's provided to you, we have not met 9 of the indicators this week. As you will see, the red-colored indicators mean the benchmark was not met. The green indicator means the benchmark has been met. We'll go right into testing positivity. Our overall positivity rate continues to increase. We're currently at 16.41%. The red line on the lower left-hand graph indicates a running 7-day average, representing an overall increasing trend. Although it is increasing, the upper right graph shows that overall positivity rate has been steadily increasing since its low of 12.14% back on October 25th, 2020. So when we get into the daily lab positivity, over the last 2 weeks, we've seen an increase in these positivity rates. The lower left-hand graph shows our daily lab positivity rate has averaged 6.58%, which is above our targeted 5%. The red line in this graph indicates a running 7-day average. Although we are seeing an increase in our daily lab positivity rates, it is not an average more than we saw in January, where we were at above 10%. When we look at our hospital census, as the chart in the lower left shows, over the last 2 weeks, we saw a slight increase in patients being hospitalized with COVID-19. Yet we are seeing approximately 4% of our total beds countywide being used for COVID-19. In January, we were seeing twice that amount. The chart in the upper right shows the historical trend of COVID-19 hospitalizations in Palm Beach County. When it comes to our death rate, the graph in the upper right corner shows that our COVID-19 related deaths continue to slowly decline. We have seen our death rate, that is the number of deaths divided by the total number of COVID-19 positive cases, decrease slowly since mid-July. The death rate currently stands at 1.95%. The 7-day average of daily deaths is averaging 1.29 deaths per day. As it relates to our ICU cases, Over the last month, we have seen our COVID-19 patients in our intensive care units countywide fluctuate. The graph in the upper right shows the overall COVID ICU cases since April 2020. The graph in the lower left corner shows the last 2 weeks' trend. Currently, approximately 15% of all ICU beds countywide are occupied by COVID patients. That's about 53 patients per day countywide. Although this has increased, as you recall, we were treating an average of 149 patients per day in our ICUs back on July 20th, 2020. Our countywide ventilator utilization rate remains stable, and we continue to hold biweekly calls with our hospital. As it relates to our daily med alerts, those are individuals who call 911 and were listed as a med alert as they had COVID-like symptoms. You'll see by the chart in the lower left corner, the med alerts have on average decreased. This past week, though, it increased slightly to 6 patients per day. And then emergency department visits with COVID-like illnesses. We have seen that weekly counts of emergency department visits presenting with COVID-like illness have increased over the last 3 weeks. This week, our COVID-like illnesses increased to 526 visits. In mid-July, though, the visits with COVID-like illnesses peaked at 1,090 cases per week. As we continue to provide testing, we have conducted over 848,377 tests in the county. Residents continue to have access to over 115 different sites, and Palm Beach County Fire Rescue still does homebound testing. We continue to have our daily multi-agency calls. Through these calls, we monitor and provide logistical support and information to Dr. Alonso and her team from the Department of Health, and Darcy Davis and her healthcare district team that operate our permanent locations, as was just shared in both their reports. We continue to have 3-time calls each week with the state EOC, and we update our municipal partners weekly. In closing, our previous presentation of the CPR matrix showed 5 red areas. This week we are at 9. As you noted, the overall positivity rate and daily positivity rates have climbed. Our emergency department visits with COVID-like illnesses and some of our med alerts have climbed slightly. And our daily hospitalization rates and ICU rates have increased. But yet, on a positive note, our death rates have decreased, and we have vaccinated over 592,917 people within Palm Beach County. We need to continue encouraging people to get vaccinated while we still wear a mask, wash our hands, and watch our distance. That concludes my report.
Thank you, Mary Blakeney, and to all 3 of the professionals before us today for your continued efforts and leadership. I know that there are many members of the board that have questions and comments, so we'll turn directly to that. We'll start with Vice Mayor Weinroth and then to Commissioner McKinley.
Thank you, Mayor. Ms. Davis, did I hear you correctly where you said that only 60% of your healthcare employees are vaccinated?
That's correct.
I think that is something that really is troubling, not specifically with respect to your population of educated employees, but that it points to a problem that we need to be focusing on. And if only 60% of your population has deemed it appropriate to get vaccinated, then we need to be doing a better job of explaining why our population needs to be embracing this more readily. And I think that I've had this conversation with our county administrator. We need to be putting more money towards PSAs and address this problem, and it is a problem. I'm looking at Israel, which is now has over 56% of its population fully vaccinated.
Yes.
And that we cannot meet or match that is troubling. So that's my first remark.
Sure.
My second, you have 25 to 30% not showing up right now. Are we considering allowing walk-ups at this point?
So the walk-up model would be more appropriate in our mobile unit, at our at our mass sites, that's not really the model that we had designed, which includes making it a more expeditious process for them to get through, so that all of the paperwork, everything is done in advance. So we did look at that, but it requires us redesigning our entire approach for those mass sites. Much easier to do in a mobile unit.
But you do have those terminals available where people could come up and do their online registration if that was deemed appropriate and it could be worked into your workflow.
It does slow down the process significantly, even doing it on site, because right now, 80% of the individuals that do show up are doing their pre-registration before they arrive. That keeps the flow going through, so.
My only fear, again, to the point of people not embracing this as much as we need them to, is I would like to remove as many impediments as possible. And certainly, we'd like it to be like a flu shot where you can walk into CVS and say, I'm ready for my flu shot, and you can get it because you thought that today I'm going to get my flu shot. I think that you certainly, and Dr. Alonso has alluded to the fact, we want to get out of the business of giving vaccinations at some point and leave this to the CVSs and the doctors to do. And I think that the sooner we can get to a point where people can just walk up to our vaccination sites, I think the better. And again, we need to attack this with a real energy, because the number of people who are now coming for vaccinations is inadequate for us to really be expecting we're going to have herd immunity anytime soon.
On that point, Vice Mayor, let me recognize the county administrator.
Vice Mayor, we have, I live with these individuals now, but we have definitely discussed the walk-up possibility. We will have and are going out as pop-ups with the walk-ups. So it's not that we're not doing it, it's just not conducive to the model that the healthcare district has in the set locations they've got today. But as she stated, as we start to wind down, we see more and more, less and less people coming to those sites. We're now able to deploy her staff on the mobile units to target areas that they will be able to walk up. We will also be working, if we're going into a municipality, working with those municipalities so that their community leaders can help pass the word that the mobile unit will be there, and they then can come without an appointment. So we're deploying a number of strategies, and as she said, and I also know that the state and the feds are going to start to reduce their pods, and so the walk-up sites are going to become much more appealing, other than going to your doctor and your pharmacist.
Ms. Davis, are we overbooking so that we can make up for some of the slack that's being created by the people who don't show up?
I would love to, but there's unfilled appointments. So we're actually not able to fill the existing appointments to even overbook to compensate. So it's a double-edged sword right now.
I hope our residents who are watching this had just heard that, and so that there should be adequate availability on a daily basis if they're so inclined to get their vaccinations.
Absolutely.
Okay. And just one point on the Restart program. I mean, I've said this many times before. The number that has always been the one that is really the one that I look at is hospitalizations and mortality. And I think that, notwithstanding the fact that hospitalizations have crept up, I think that we're still in a good position as far as mortality and hospitalizations. I'm concerned that we may be spending too much time focusing on positivity, especially as more and more people are getting vaccinated, which means those people tend not to get themselves tested anymore unless they're being asked to get tested for an activity they're going to engage in. And so we're now having more and more adverse selection, and so those numbers may actually not really be a good indicator of what the positivity is within our population. I don't want to say anything that's going to stop people from getting vaccinated, but certainly I want to stay focused on the fact that we are staying very close to the same number as far as mortality. Any people dying of this is too many people, but we certainly can be, this is not Italy, and this is not India, and this is not Brazil. So we certainly have a much better control of this. Thank you, Mayor.
Thank you, Vice Mayor. Commissioner McKinley, then to Commissioner Marino.
Thanks. A couple of questions. The younger population, those numbers being so low, do you think the hours of our operation have anything to do with that? I mean, I know like 10 o'clock to 4 o'clock in Pahokee on a Friday is not really conducive to anybody who has a job. And it's good they offer it on Saturdays as well, but our hours of operation at our other sites, should we be looking at changing some of those? How late in the day do we go?
The pharmacies are open as long as the pharmacies have longer hours, but even there, I have asked several of the pharmacies, and even there, their evening hours are very poorly attended. That's why they've gone up to walk-ups, because they're just not making those appointments. We have not had anyone ask for, let me put it this way, the appointments that we have during our operation of 9 to 4 have been booked consistently. We have asked different community groups to expand into the evening. Some of the walk-up sites have done that, but again, the numbers are low, very low in the evening. So while we may catch a few extra people, the majority are coming and taking time to get vaccinated. As we go forward and we start doing the mobile units, that definitely will be something that we can adjust, because we'll know who the group is that we're going to vaccinate, and we can make those requests from the community itself. We'll do what the community is asking us to do.
Right, but our numbers in our senior population are higher. A lot of those seniors are retired, and so they have the flexibility of going in the daytime. But our younger population does not have that flexibility, and I'm asking is, do we believe that the hours of operation are causing that low turnout? We've got an operation in Wellington this morning. I mean, that'll be done by noon. So anybody that has to work, they had to wait till 9 o'clock in the morning to show up, and then it's done by noon. So that closes the door for a lot of the younger, the 50 and under population. So Darcy, the fairgrounds, what time do they close?
So we are open today at North County, South County until 7 p.m.
Okay.
And again, as I mentioned earlier, we only filled 50%. Not, it was an even distribution across the time slots, but, 50% capacity, 11 to 7 today. We stagger throughout the week, depending upon where we are. Sometimes 9 to 4. But 11 to 7 is distributed throughout our schedule.
And what I'm hearing from a lot of young women is a hesitancy in getting the vaccine because of possible implications on fertility. What can you tell me about that? Where can they go for information?
Thank you for asking that question. You're absolutely right. That is one of those myths that has occurred on the internet. There's absolutely no evidence of any infertility due to the vaccine. I would love to have some conversations with females that are concerned about infertility. They probably have to take some sexually transmitted disease classes to see that infertility is going to occur because of other things, not because of the vaccine. So please, that's a myth that we have to dismiss. And I think it's going to take a lot of education and a lot of talking one-on-one with folks about those issues that have been kind of spread falsely through the internet, through chats and things like that. But I've heard that over and over again. So that's definitely a conversation that needs to be had one-on-one, and we plan to do a lot of that. As a matter of fact, we've got several Zoom presentations that we're going to do with some minority areas, and that is one of the topics I'm really going to address.
Is there a place where we can go to get some information from researchers that we can share with our constituents that have that concern?
Well,
Is there a white paper somewhere out there that we can share?
the CDC has frequently asked questions, and that it's also on our website that there's no evidence of that. But the problem with trying to dismiss a myth is that there is no proof to dismiss because it doesn't exist. So it's really hard to get rid of those things, those urban legends that occur. There's still people that think that there's chips in the vaccine also. So we just have to do one-on-one with people that have that hesitancy because of those ideas.
Okay, and then switching topics here, on the variant report, that's still just a sampling because not everyone is being tested for those variants. So those numbers are just a small reflection of what could possibly be out there.
Correct. And that continues to be the fear, that we don't want the variant to become the dominant virus. Right now, the vaccine is working against all of them, so it is effective against the variants, and the mask also protects against the variants. But once a virus mutates and becomes dominant, then that effectiveness, it can really change to the point where the vaccine is not effective. The miracle, well, not the miracle, the scientific process of this vaccine is so that because it's going to create antibodies against the protein spike of the virus. This is one of the reasons they created this vaccine in this way, so that it would be effective, because all viruses mutate. So that scientists that created this and that have been working on this for years and years did that on purpose, so that it wouldn't be constantly changing and the vaccine rendered ineffective. So let's keep our fingers crossed that this continues to work and that we're able to get that 15 to 44-year-olds vaccinated so that the numbers don't continue to go up.
16.
On that herd immunity question, though, reading some articles, I mean, the vaccine isn't meant to last a lifetime. So is there a point where we're all going to need to go and get a third booster?
Yes, H1N1 in the pandemic that occurred in 2009, we're getting that vaccine every year when we get our flu vaccine. So it will probably either get added to the flu vaccine at some point, or it may become a separate vaccine because of the uniqueness of this vaccine as compared to the others. So that's still a process that has to be determined. At this point, we've only been able to test the vaccine for 6 months. So we know that it's good for 6 months. As it progresses and we study this more, we'll know how long it actually lasts. That's how we find out. And not just here in Florida and not just in the United States, but globally.
Okay, I think that's an important point to make. Outreach questions. Has anybody reached out to our community-based care provider, to ChildNet, to talk about trying to get the vaccines into some of their group homes for that 16 and older population?
I have not talked to them. The last time I talked was in the very beginning. But I'll be glad to call. Have they made any inquiries to your office, or?
I just heard it come up on a phone call last week, and people wondering what, if any outreach has been done. So if somebody could give Larry Ryan a call and see.
I'll be glad to call him, sure.
Perfect. And then the fairgrounds, Darcy.
Yes.
The fair is about to start.
Yes.
So how are we going to accommodate your operation with the fair?
So there were a few days that we had to scale back hours because of the disruption with the fair. So I think it's May 7th and 8th where we have, 8 to 12 at both sites. And we are trying to accommodate, those will be second doses, but we'll have a presence at South County and North County trying to work around the volume of people that we expect to be there. So those were the 2 days, the 2 key days that we had to adjust our times. The rest of the week that they're there, it was not an obstacle for us.
Good. And then my last topic, and you guys have heard me talk about it a lot, and that's our farm workers. And we were rolling pretty good with Jared Moskowitz and his commitment, and we had about 3 farm worker housing complexes, actually 4, that were completed before Johnson & Johnson hit the pause button. We've had one farmer, and their farm workers and their packing house workers are here just long enough to be able to do the 2 doses, and that happened over the weekend, and I'm very thankful for that. I'm looking at my spreadsheet, and I know that I've got 2 different producers that have, 430 at one and 600 at another, so about over 1,000 workers that leave at the end of this month. are we hearing anything about Johnson & Johnson and their timeline for making a decision?
I'm going to say I don't know the answer to that. I know there's been a lot of talk, and they're going back and forth, and they're hoping to have something soon, but they haven't set a date, so I'm not going to say a date or guess.
And these workers, they know where they're going next. Do we have any ability, I know it's last minute, to coordinate? Is it beneficial to get one shot in the arm and then try to coordinate with the location that they're going to make arrangements for them to get the second shot?
We do that all the time with the health department. So, I mean, we track employees that have tuberculosis, and we track other folks that we go and we work hand in hand with other health departments. So if we know where they're going, it'd be a matter of coordinating in a group, perhaps, if they're going to Georgia or Kentucky, or, you know, that's very possible to do from health department to health department. Just, we can talk about it. I can help you.
Okay, I've got 10 days.
Okay.
So if we could start having that conversation today, particularly with those two growers that we know of that are leaving by the end of the month.
Okay, call me.
Okay, thank you. Thank you, Mayor.
Just don't call her during the presentation. Thank you, Commissioner McKinley. We'll move now to Commissioner Marino, then to Commissioner Sacks.
No.
No.
Going to share microphones here. To follow up on Melissa's last question, if they get one shot, is it possible that the next booster could wait 6 months? And then, I don't know what the time frame is for the schedule of your workers to come back. Is that a 6-month time frame, or is it a?
Depends on the grower.
Okay. So that would be kind of one of my questions would be, is there a 6-month
Obviously,
window?
the time frame should be the 3 weeks and the 4 weeks for the Moderna, 3 weeks for the Pfizer. However, if a person misses the vaccine for any reason, including hospitalization and other reasons that they have missed the vaccine, we go ahead and give that second dose whenever they are ready to get the second dose. And it is a booster. So it's not recommended. It's not in the the protocol, but certainly you don't have to restart the vaccine all over the series. It's not like hepatitis where you restart the vaccine. So that would be possible to get the second dose at whatever time they are able to get it.
So worst case scenario is they could get a single dose now, and if their schedule flexes them back here in 6 months, they can get the second dose in 6 months.
That's correct.
Well, that's helpful to know. A couple of questions. Refrigeration, are we still having a refrigeration issue? Is there a time frame?
We don't have, I'm not aware of having a refrigeration issue.
Okay, good.
We don't have a refrigeration
So
issue.
that, I mean, the opening of the vials, and then you have to give out.
Oh, well, that will always be,
Yeah.
no, that's certainly that's still the protocol for handling the vaccine in terms of how long you have that it's viable. But that's not really refrigeration as much as it is just the manufacturer's specs on how you treat the vaccine.
And that's why the cancellations are an issue.
No. Cancellations haven't been because of the handling of the vaccine. I'm not sure what you're asking.
So what I'm saying is just once you open the vial that has 6 shots in it, you need to give those 6 shots out. So
Yeah.
cancellations affect that whole procedure.
Right.
Well, we go around and look for people when we have 6 shots
do.
left.
That's all I got mine.
We do.
What are we doing for the research for the under 16?
All of the vaccines will be doing studies. Well, as a matter of fact, I know they're using 12-year-olds now. I think that, it's more difficult. There's more steps the younger you go, but the normal flu vaccine's given up to from age 6 months and above. So There's no reason that children can't be vaccinated. It's just a matter of making sure that they enter the study so that everybody is safe and it's known that there's no consequences to it.
And to continue on Melissa's question about timing, if you're between the age of 16 and 18, do you have to have a parent with you?
Yes,
Okay.
or a guardian.
Or a
No,
guardian?
yeah.
Okay, thank you. And if someone's here out of town, out of state, out of country, are they able to get a vaccine? I know that's not a popular question. But if we've got appointments that are going unused, I mean,
I think that even though the executive order hasn't changed or the wording hasn't changed, I think that with the availability of the vaccine being robust, that people are relaxing the demand for all kinds of information, including, are you out of county? Are you out of the state? The idea now is to get shots into the arms as many people as we can.
well, I do have to say, the emails, there are no more emails saying I can't get an appointment, and I have not gotten any more homebound senior emails saying that they haven't been able to get the shot. So that's a thank you to you all for getting the appointments filled as much as you can and making it available to everybody, and being able to reach our homebound seniors. So you said your mobile units are 500 a day per unit, so that's 1,500. So after May, when you propose to close the bigger sites, is that how we're going to get shots in arms, is the mobile units, or do we have pods, or how are we doing that?
We can both answer that. From my perspective, we will continue to distribute the vaccine through the health department for our community partners that don't have access to the vaccine. And we will target those hard-to-hit areas. We have a mobile unit also. The healthcare district has the pretty ones. And we'll be able to go out. I mean, that's part of what we do all the time. We have an immunization unit that's what they do. We will also be out giving other vaccines, like school vaccines, that we need to get a lot of kids that have not been vaccinated for school. Please, if you're listening today and your child has not been vaccinated for school, please make sure that they get vaccinated. We don't want a measles outbreak in the middle of all this. So we will continue to do that through our mobile units and be able to go out into those areas. Most of the people are not going to be going to our mobile units. The majority of the people, we're seeing the increase in vaccinations right now. It's just that we're not doing them. We're not doing the mass vaccination at this point. It's being done by the private sector or
The Publix,
these
the
other
Walgreens,
sites.
the, yeah.
That is why the state will start pulling back their sites, and probably the feds will eventually pull back their sites also. There's also contracts being done by agencies that they're in the business of vaccinating. They will charge insurance, not the people, for the vaccine, and that's how they make their money. So those private sectors will also probably be joining the additional areas that will be vaccinating. And of course, vaccines are going to be available at every spot that has nurses and doctors that can vaccinate.
And Place of Hope, have they contacted you also? Those are also group homes for, kids that are in high school and whatnot. Have they contacted you? Charles Bender?
Yes, we have had them come to the sites. We have arranged for also healthcare workers in those areas to get vaccinated. So we have had several of those folks come through our site at Mid-County.
Okay, and last question is, how do you address people who do not have ID in getting a vaccine? That's a big question.
The IDs is not a new issue. We have had homeless, we have had outreaches for migrant workers. Lots of people don't have a driver's license, for example. So what we've done routinely is there are many community partners. There are faith-based organizations. There's legal aid. There's a ton of places, including doctors' offices or clinics, that can write a letter of verification that they know this person. They know their date of birth based on their medical records. They know where they live based on the addresses that they have. They know the person, and so they can write a letter of verification which serves as an ID, and we take those, and I know the healthcare district takes them, because we do that all the time for other reasons other than COVID. So that's something that's been in existence in this county for as long as I've been here, over 30 years. So, I mean, working, I've been here for my whole life. So that is a common practice here in Palm Beach County, and many other counties have that also.
Thank you. Thank you. I think I'm done.
Thank you, Commissioner Marino. We're going to move now to Commissioner Sacks and then Commissioner Bernard.
First, thank you for all you do. I think that so much of our success in the number of vaccinations that we have and the decreasing numbers of those who are hospitalized and who pass away is because of your good efforts, and it has not been easy, I know. Let's look at something. Is it, and this is to all three of you, if anyone can answer, is it mandatory at any state or county office that everyone be vaccinated before they go to work or do any of their duties?
Only in the private sector.
So at no county departments, whether it's a not a nonprofit that receives county or state money, is that mandatory
Not to my
that everybody there be vaccinated?
Not in the health department. I only speak for the health department.
Not to my knowledge, no.
And I hear from my left, not in the county. Now, moving on from that. According to Ms. Baker, we would like them to be, but up to now that has not happened. Moving from there to our school district, I know the signs that I would see, no shots, no school, for years for the children going to our schools. Is it required for school children to have flu shots or to show indication that they've had vaccinations against measles and other infectious diseases before they are allowed in county schools?
That requirement is very specific with specific vaccines. The flu, for example, is not mandatory. And this is a flu vaccine, so it would not be mandatory. As we see, things that are mandatory have a certain rebellious nature in us that automatically wants to reject it. So even though I'm a very strong public health advocate, and I see how well countries do that mandate people to get vaccinated, that doesn't go well in the United States. And so I think that the way to vaccines and the way to do this is by constantly educating and having a conversation with your patients as providers, as physicians, as nurses. Now, it's very disturbing that in the very medical setting that we sit in, we have professionals that don't want to be vaccinated. And so that is an existence that we have to accept. Luckily, nature takes care of that for us by only needing 70%, 80% herd immunity. So nature expects some people not to get vaccinated.
So that is, I'm so glad you brought that up, because that's called the herd immunity.
Correct.
And I know that this is a very important issue for those people, Americans, who, as you stated, we don't like mandatory anything. And this also is a mandatory something, which we have in the county. Can anybody give an opinion as to at what point does the herd immunity take over so that it would not be that necessary for all of us to be required to wear masks and, of course, wash our hands and follow the social distancing? And this is, again, I'm asking for any type of medical opinion. We all have our opinions on it, but any medical opinion that either one of you would have to at what point of the percentage of people who are vaccinated that we could move away from that mandate.
The CDC hopes to get 70% herd immunity for the United States. My opinion is that it needs to be more than just the United States and the global world that we live in and travel.
So the CDC is saying 70% of everyone who is vaccinated in a let's say a closed group, such as in a way the state of Florida or Palm Beach County, 70% would then give herd immunity to those who may not want to get vaccinated. It's is their right,
Yes, we
I guess.
protect them.
And we would protect them, and then we could move away from their requirements. Does anybody, and that's a medical opinion. Anybody else have any medical opinion? Okay, good, good. And one last question. We have heard, and my fellow commissioners have done a very good job in these questions, about how we're offering this to anybody, correct? Anybody with pop-ups, with walk-ups, with Publix, with, the fairgrounds. Is there any excuse for anyone in this county who wants a vaccine not to be able to have the opportunity to get a vaccine?
Well, other than a medical condition that your doctor would say
No,
that
is
they
there
don't recommend it.
anything that we have failed to do as a county to make this opportunity available to anyone who wants the vaccine?
I would say that right now, anybody who wants a vaccine can get one. There are 10,000 open appointments for the healthcare district at, give your website quick.
vaccine.hcdpbc.org. But to tag on to that answer to
Sure.
your question, I do think there are access issues, and I think that's where the mobile units come into play. So I think, yes, there is a sufficient supply. Yes, there are access points, but as we know, as Commissioner McKinley brought up, there are vaccine deserts in some of our own communities, and that's where we now need to take our resources and go help educate, because I think it's going to take a little bit more grassroots effort and trust, frankly, to bridge the trust of individuals that this is a safe thing to do. And so you do it, we do it on a smaller scale, but more targeted in the right places.
I appreciate that so much. And you are all working on being able to get into those vaccine deserts so that, one, we educate them, and two, we make vaccines available to them throughout the district, throughout the county.
Yes.
I appreciate that. Thank you very much.
I would add one more thing. It's not just education. Sometimes it's just a conversation. We have to be ready to accept the vaccine. And sometimes we come across, I try not to tell anybody, you have to, you should do this. I'd rather have a conversation with them and see where they are in the spectrum of being ready to get vaccinated. And sometimes they just need to be ready when they're ready. It's a very flowing thing. It's not, you check all the quiz questions and you got 100 on the test, therefore you're going to get vaccinated. It doesn't work that way.
And I want to thank you for your candor, especially to reach out to those areas, because that's our task.
Yeah.
That's our job, and I appreciate that. Thank you very much. Thank you, Mayor.
Thank you, Commissioner Sacks. We'll move now to Commissioner Bernard and then Commissioner Weiss.
Thank you very much, Mr. Mayor. Commissioner Sacks mentioned, the question, which was, if anyone wants a vaccine, can they get it? And then, Darcy, you answered it, correctly, that, there are some access issues that, that we have to, micro-target, and for us to have that conversation and information and education, so in that way, when they're ready, they can take the vaccine. And, Vice Mayor Weinroth had mentioned the PSA. I think that's really, really important for us to work on. And what I do hope is that we're able to create a plan in terms of targeting, the minority community and also our young kids. They're all on all these different platforms, and so we're going to have to be very creative to educate some of these kids, that are catching the virus, and some of them may not want to get vaccinated. But I do have one question for you, Dr. Alonso. You had mentioned that, we want herd immunity when you get 70% of the population to be vaccinated. But one of the things that you had mentioned was, the vaccine right now may last 6 months. And since, some of our seniors initially took the vaccine, in late December and early January, what are the plans in regards to the CDC and the state? Have they started having conversation regarding our residents who are gonna pretty much have to get vaccinated?
The only one that made a mention, I think it confused things, was the pharmaceutical company that said a booster may be needed in 6 months. That is not a fact. That is a manufacturer's talking about the future. We don't know how long the vaccine lasts until we spend enough time checking on how long it lasts. So right now, we know it definitely lasts for 6 months because that's how long we've been able to study it. As we go forward, we'll see whether it lasts a year, maybe it lasts 2 or 3 years, and we'll only have to do it, the pneumovax, for example, is every 5 years. So different viruses have different lifespans in terms of the vaccine life and how long those antibodies last in the body.
But some of our seniors are gonna kind of like have questions regarding this. So what I would hope is that if we can work with, the Surgeon General and for the state of Florida, so in that way we can kind of like give our seniors directions in terms of, how long will this vaccine last, and do they go and take a second booster shot?
No,
And-
that's not going to be recommended until it shows that it lasts or doesn't last for a certain amount. And that's not going to be done by the Surgeon General, certainly not by the Health Department. That's going to be done by the CDC, the World Health Organization, and the manufacturers that are actually studying the vaccine. This vaccine is still being studied. Remember, it's out on emergency use at this time. And we're very lucky for that we've been able to do that so quickly to be able to get those answers. But this vaccine is still being studied. And that's one of the things that we have to see. How long will it last?
Okay.
It might last 2 or 3 years.
Yeah, I'm just concerned that, that we have some of our seniors and, they would want to know if this vaccine is only going to be for 6 months, and, that's 6 months is right around the corner.
Well, I've talked to them, and I've just told them they have to wait and see. That's really all we can do at this point. We certainly cannot start vaccinating people with boosters in 6 months. Not until that's a directive from the manufacturers as well as from the CDC and the FDA and everybody else that has a say in how the vaccine is administered.
Okay. Thank you very much, Dr. Alonso.
Thank you, Commissioner Bernard. Commissioner Weiss, you recognize, sir.
Thank you, Mayor. Just a couple things. I understand, and again, thank you for the answer and understanding that we still have challenges with access. And one of the things I had heard is that people can call the healthcare district and book appointments via the phone now. Is that available?
So we've had a helpline, I think since maybe one of the times I was here and you brought up, rightly so, that there were challenges with the, internet or perhaps the computer system. So we've had that helpline available in 3 different languages. We are finding that seems to be the way we're starting to fill a few more appointments is through the phone. But it's been around for a while.
And I guess the other thing, just to add on, there are people that volunteer out in the community that are helping other people that have access issues, and I know that they're still very much being engaged and asked to help book appointments. So I think we still have this challenge with people that don't either have access to technology, don't know how to use the technology, whatever it might be. So I think, and I think you're right, the plan for the mobile sites going out is probably going to be very helpful in helping to get after that. And just to help illuminate a little bit more about what Commissioner Bernard was asking about, I know we here in Palm Beach County, we have people that participated in the Moderna trial. And so I have a friend of mine who was one of those participants, and I want to say it was back in July, I think, that time frame when he got his first dose. So we're going back, so now they're a little bit further ahead of everybody else. So there's a little bit of a window further out, that they're able to see. So, I know they continue to monitor his antibodies and trying to understand, how long they can continue to have a strong reaction or implementation.
And does he still have antibodies?
As far as I know, he hasn't mentioned that he's had to be revaccinated, but they are continuing to study those folks. So.
That's great.
All right. Thank you, Mayor.
Commissioner Weiss.
I just want to take a couple moments to
to recap some of the emerging issues in society right now. I'll start with saying I think we're in a classic American dynamic, which is we have an oversupply of vaccines readily available with infrastructure to distribute it and a lack of willingness in certain demographics and certain age groups to embrace what really is a scientific miracle. Like the Vice Mayor, I've looked to other countries, and we can talk about South America, we can talk about Brazil, Guatemala, even in Europe, we look at France, just going through hell, and Italy. And a bright spot is Israel, as you pointed out, Vice Mayor. A lot of people in this world would pay everything they have to be in a position that we're in right now, to have such robust access, and yet there is a tangent in society that is very much concerned about the efficacy of it, about the health impacts, and they're entitled to that perspective. But we as a government have an obligation to help inform the public. And so as I think more and more about where we're at, the first stages of this pandemic 400 days ago, what we did in that moment affected where we were at day 100. What we did then affected day 200. Where we are at now, at day 400, what we do from this point on will affect the outcome of this county's economic future, public health future, and a lot of other aspects. We have a window of opportunity here to really make an impact. And a lot of it's going to be policy driven. We talk about things like the fair getting in the way of distribution, and I think that we're lucky to be in Florida. We have an open economic policy right now. We've done very well. Our numbers have gone up and down, but we've never been in a situation that was dire. And I say that a lot of it is to wearing the mask. We did mask mailings, and like many Americans, if you give it to them, they'll use it. So instead of looking at something like the fair, which, by the way, the fair, and to our ambassador of the fair, Commissioner McKinley, it's one of the most diverse demographic and racial and cultural events in the county. And perhaps we can start to look at, as a board and as professional leaders, about utilizing some of the open economic access that we have as points of distribution for people to walk up. I mean, how many people come to the fair and like the mask? If there's an opportunity to get vaccinated there, I think we need to start looking at that right now, because the demographic that we're looking at are people that either are hesitant or just don't want to make the effort. And if we can close that gap in making the effort easier for them, if we can have information available to them, we ought to use the open economic access that we have to help fill this gap. We also have trust issues in certain communities. We have millennials, and millennials are pretty much recognized as 1981 to 1996. I'm 1983, so I'm an old millennial, but millennials get blamed for everything. Sometimes we're guilty and sometimes we're not. But I can tell you, millennials are not hyper-focused on this pandemic like the rest of us are. And I think the incident commander and the board needs to think about ways to engage that community. Nobody wants to hear from me anymore on this issue about getting vaccinated. I get that. But there are people in this community, again, I spoke about it at the press conference. A friend of mine, she's 26. She got through COVID fine, and she's a long hauler now, and she's freaked out. Those are the types of PSAs that we need on TikTok, on Facebook, on all the social media platforms I hide from. That's where we need to be investing the money that the federal government gave us. Israel is an interesting topic because they actually use incentives to get the younger generation out to get vaccinated. And I'll just say it, I think if we said, hey, if you go to Publix, I know we're trying to deconstruct at some point in the future our governmental infrastructure for distribution and testing and vaccines, but we have such a robust retail footprint in this county. If some of those PSAs included incentives, like come to Publix and you get a $10 gift card, show up for the second one, you get a $20 gift card, that's what's going to inspire, unfortunately, sort of a lethargic generation of people not wanting to go do it of their own volition. When my colleagues on this board were kind enough to reappoint me as mayor, my only ask of you was, now that we're getting into we've had our emergency response, and that really wasn't policy driven. We did what we had to do. We weren't perfect, but it was robust, and I'm proud of it. But now we're getting into these micro issues of how do we land this airplane? Because you can have a great flight, but if you don't land the airplane, I love airplanes, it's all for nothing. So we're getting on that final approach to landing it. And if we can get 10 more, 20 more, 30 more % vaccinated in this window, that's going to pay dividends for the rest of our eternity here in Palm Beach County. So my ask to the board at that time was find a wheelhouse that is important to you and your community, whether it's access or distrust in the community, whether it's millennials, whether it's utilizing economic tourism. I have a letter here from Commissioner Sachs, who's interested in sort of handling the technical and economic aspects of this as we emerge onto the final path. I would ask my colleagues on the board to look at something important to you, and let's find a way to utilize our skills in these final moments of this pandemic, and to work with the administrator and to work with the funds that we have. We have some great ideas up here. We're elected by the people, and in this final phase, we need to find what is in our community, what's going on, and how we can help target those specific communities to make sure that we get that extra 10, 20, or 30% vaccinated, because that would be a godsend. So I don't have the answers right now. I'm sort of speaking directly to the county administrator about some of the collective thoughts I think that have come out of this very substantive update. We're starting to transition from testing, vaccine, and all that stuff to how do we micro-target what's so important in this county. I think there's a recognition that we are at that point in time. We're certainly not done. I think whether we have a mask mandate or not, people ought to wear the masks, and we ought to think about ways to continue to push that message. I know that I'll be wearing it for the foreseeable future, whether it's mandated or not, and that's a personal decision of mine. But we need to continue to communicate in a targeted fashion and bring those folks that are not in the fold right now to the table through use of incentives, through use of messaging, through use of large events where people go, and get them engaged. I guarantee you, you set up a site at a large event and people that were on the fence or didn't know how to go about it or didn't want to turn on the computer, you're going to get a lot of people that say, you know what, it's accessible right in front of my face, there's no excuse not to do it. I can't help those folks that that 30% that nature accounts for. We can't change that, but there's a lot more that we can change, and what we do in this moment is going to be very impactful. So I wanted to get that message out so that we can start the creative process that has already begun quite a while ago, but let's get it out in public and let's start seeing what we can do. Were there any last-minute questions or comments from members of the board? Commissioner McKinley, you're recognized.
Well, everybody loves a pub sub, so I'm wondering if you want to market that of like a shot and sub or sub and shot.
I like it. There we go.
But I think what you're talking about is doing the blood bank model. You know, and they incentivize people to donate blood, and they get corporate, donations for movie tickets or some other type of event, and that's how they get people to donate blood, and it works. So I think
It's the
you're on the right
American
path.
way. And has anyone seen the Boston Lager commercial where he goes in for his vaccine? I mean, we're starting to see corporate America get involved in their messaging. And it was a really well-done commercial. And for that 35% of people that don't pay attention to the news, that don't care what CNN says, that certainly don't care what we say up here, when they see that commercial and it's about, your cousin from Boston that's going in to get his vaccine and he says, he faints. I don't want to ruin the storyline for you, but we're starting to see a robust response from corporate America about messaging on how important it is to get vaccinated. We ought to step up to the plate a little bit more robustly and include some of the incentives that the government has allowed us to utilize through our taxpayer funds. I'll get off my soapbox. I thank you very much, everybody, for your comments and work here today, and we'll move now to the regular agenda. A reminder that if you want to make public comment on any agenda item, to please do submit a comment card to a member of public county staff, and we'll have you heard.
Mayor, make a motion to receive and file proof of publication.
Motion by Vice Mayor Weinroth, second by Commissioner Weiss. All in favor, all opposed, that motion passes. We'll move to public hearings, which start on page 33 of the agenda. This is public hearing 5A1, Public Works. The county engineer is recognized, sir.
Good morning, Mayor. Good morning, Mayor, Vice Mayor, members of the board. What you have before you is a recommendation for some property in the city of Boca Raton Golf Course. I need the clicker. I'm sorry. So this is a public hearing to discuss disposal of the abandonment of that area. Next slide, let's see here. Second. There you go. The area was part of our inventory years ago. The area is not much of an area. It's part of the golf course, was about 200 acres. The site is only about 600 square feet in terms of the location, in terms of the area that needs to be abandoned. And the purpose of the abandonment is that the developer in the city of Boca Raton wants to do some development of that area, and they want to free any encumbrances of that property. And so, and like I said earlier, this is part of previous ownership by the county. We got a request to clear the encumbrance to allow the incorporation of the abandonment site to an existing development known as the City of Boca Raton Golf Course. Presently, the golf course consists of 2 adjacent lots, and this abandonment is required in order for the lots to be legally combined through the platting process. And so the recommendation by the staff is to, part of the agenda item, is a resolution abandoning any public interest in a portion of the road, dike, and ditch reservation lying in Block 76, Palm Beach Farms, Plat number 3, according to the plat thereof, recorded in Plat Book number 2, pages 45 through 54, public records of Palm Beach County, and being a portion of Section 17, Township 47, South Range 42 East, Palm Beach County, Florida. That concludes my presentation.
No public comment. Is there a motion to abandon?
There's a motion to abandon.
Motion made by Vice Mayor Weinroth, seconded by Commissioner Weiss. There's no comments from members of the board. All in favor, all opposed, the motion to abandon on 5A1 passes 7-0. We'll move now to public safety, 5B1, which is a COPCN issue related to a private security company. Would any commissioner request a presentation on this item? Is there a motion?
Motion to approve.
Vice Mayor Weinroth has moved the issuance of a COPCN secondary service certificate. Is there a second? Second by Commissioner Weiss. There's no public comment or comments from members of the board. All in favor? All opposed? That motion passes 7-0. We're on 5B2.
Motion to approve.
Motion by Vice Mayor Weinroth on the issuance of a secondary COPCN. Is there a second? Second by Commissioner Weiss. There's no public comment. All in favor? All opposed? 5B2 passes 7-0. That was the item with a revised summary, which was ministerial. 5C1.
Mr. Mayor, I move to approve item 5C1A, B, and C and state that neither the taxing power nor the faith and credit of the county nor any county funds shall be pledged to pay the principal, premium, if any, or interest on the note.
Second.
There's a motion by Commissioner Bernard, seconded by Vice Mayor Weinroth on 5C1, which is a private revenue bond that the county has no, will not pay any principal or premium or interest. As Commissioner Bernard noted, there's no public comment. Vice Mayor, you made the second. No further comment. All in favor? All opposed? 5C1, A, B, and C passes 7-0. We're now on 5D1. Which was brought to the board initially. There is public comment. We voted 7-0 on this item earlier. It's water utilities related to Palm Beach County Water Utilities Department Uniform Policies and Procedures Manual. We'll get a brief presentation from Mr. Stiles. Sir, you're recognized.
Good morning, Mayor, Vice Mayor, Commissioners, Administrator Baker. For the record, I am Jim Stiles, Director of Water Utilities. We are here today to ask for support to adopt an ordinance repealing and replacing ordinance number 07-003 as amended, providing for a schedule of rates, fees, and charges for potable water, wastewater, and reclaim services. Joining me are Todd Bunlaran, Assistant County Administrator, Michael Jones, Senior County Attorney, Kenny Rampersad, Wood, Director of Finance and Administration, and joining remotely, Scott Harder, President and CEO of Environmental Financial Group. We will begin with Todd providing an overview of why we're doing this now.
Thank you, Jim. Mayor, Commissioners, The last rate study that we did in Palm Beach County was back in 2009, so about 11 years ago. Typically in utilities, you try to look at things every maybe 4 or 5 years, but it's been that long. We've been able to index for our rates at the 0.75 of the wastewater and water CPI. So that has allowed some of our rates to continue to increase slightly to meet some of those needs as we've gone on. But what you need to do when you look at adjusting rates is you have to make sure that they are legally justifiable. And so we have engaged our contractor, the Environmental Financial Group, EFG, of which Scott Harder joins us, to do that. They have been a longstanding client of ours, or we've been a longstanding client of theirs, and they have done a number of these for us over the last few decades. The timing of this is important. We looked at doing this over a year ago and said, you know what, we're going to wait a little while to do this. But one of the things about bringing the Glades Utility Authority into the Palm Beach County Water Utility system is that this was the date in May of this year that those rates would conform to a single rate for all ratepayers throughout Palm Beach County. The Glades Utility was paying higher rates, and so this is going to allow them to come in and pay a single rate to do that. And Kenny will continue with the remainder of this presentation.
Thank you, Todd. Good morning, Mayor, Vice Mayor, Commissioners, and Administrator Baker. I'll be brief. So what is happening? This rate study is revenue neutral and confirms that our annual indexing is keeping up with our needs, as Todd said. All customers were properly notified of the rate modifications via bills in accordance with Florida statute. They were also directed to our website for all information and full transparency. There are 3 classes of customers: single-family, multifamily, and non-residential. We charge base and commodity fees. Commodity fees are based on usage and have a tiered structure. The upper tier is currently over $10. There have been cases in California where challenges have been brought to cost justify those upper tiers. This study contemplates the legal justification of all rates on these commodity tiers. Single-family customers will see lower costs in the upper tiers, shifting cost in this bucket slightly. Most Eastern residential customers will see savings, and Western customers will see significant savings. Another one of the 3 classes of customers is multifamily. Multifamily customers will all see significant savings in the East and the West. These are our condo, apartment communities, duplexes, etc. There was no multifamily designation previously in the West. They were being billed at a single-family rate. Analysis shows that non-residential customers are not paying their fair share. We saw significant savings for the residential customers, single-family, and especially multifamily. The shift does cause the typical 5/8 non-residential customer to see about a 6% increase. Non-residential does have several different meter sizes, and low-usage customers are seeing higher costs. Data analysis was key to making sure that customer class is carrying their fair share of the cost. Again, these rates are legally justifiable. Here's an illustration of where our rates stand today in comparison to smaller and larger utilities in our area for a typical residential customer who uses 5,000 gallons per month. As you can see, we are one of the cheapest utilities, and after this study, that does not change. The old GUA single-family residential customer bill is decreased substantially as well. Connection fees are going up, no question. We must consider these have not been adjusted in 10+ years, and there's no annual indexing for connection fees. There is no CPI that reflects connection fees, as they are tied directly to the value of our system and our capital improvement program. Our rate consultant utilized the AWWA buy-in method for this study. The connection fee for a typical 5/8 meter used in most residential homes is increasing by $700 or 17.5%. This percentage divided by the 10-year period where connection fees were not increased is very much in line with average inflation at 1.75%. So to close out, this study confirms rates are legally justifiable based on customer class. These modifications were communicated to customers via bills and website and discussed with the development community, including the Gold Coast Home Builders Association, as well as the Economic Council Water Resources Subcommittee. I've never met anyone that likes to see costs increase, but the response was generally supportive based on the information presented. We are now one utility, one rate, based on consumption data. There is no more Eastern or Western customers. This rate study, like I said, is revenue neutral. There is some shifting in cost in the class of buckets, as well as commodity tiers. The great news, though, like Todd said, our annual indexing is keeping up with the cost of providing the best water and wastewater services. We do have some modifications in connection fees, however, they are cost justified. This concludes my presentation.
Very good, thank you. We do have public comment on this. Before we get to public comment, I want to read into the record a correspondence that I received. I'm sure members of the board received it directed to them as well. From Gold Coast Builders Association, dear Mayor Kerner, on behalf of the Gold Coast Builders Association, please be advised that CGBA is in support and recommends adoption of the uniform rates for potable water, wastewater, and reclaimed water service agenda item scheduled for 4/20/2021. Further, we would like to commend Palm Beach County Water Utility staff for keeping our membership apprised of this matter throughout the adoption process. And I know I speak on behalf of the board when we thank you for being so transparent and communicative with the stakeholders in this item. Commissioner Bernard, you recognized for public comment.
Thank you, Mr. Mayor. We did receive one public comment form that we'll receive and file without.
Very good. Receive and file, and also the CGBA letter, receive and file without objection.
The first person will be Richard Stacy, followed by Catherine Catlin.
Mr. Stacy, I think Mr. Stacy's card, his answer or his question was answered by the agenda item itself, and he does not wish to speak.
Okay.
And so the second person.
That's Catherine Catlin, followed by Drew Martin.
Ma'am, you recognized for 3 minutes.
For the record, I am Catherine Catlin, and I represent Gold Coast Builders Association. Mayor, Vice Mayor, Commissioners, and County Administrator, thank you for your time and attention. The membership of GCBA believes it's of the utmost importance to appear in person to support the increase of rates by the Palm Beach County Water Utilities Department. We believe the increases are warranted, and the process to arrive at the increases was thorough and fair. GCBA would like to acknowledge and thank the Palm Beach County Water Utilities Department staff for keeping us advised and soliciting and welcoming our input and comments. GCBA members stand ready to work with all county departments, commissions, and committees on future issues affecting our industry and the affordability of housing. We stand ready to ensure every citizen has a safe, clean, and affordable place to call home. Thank you.
Thank you, and thank you again for working with our utility staff and staying the whole time to make public comment. We appreciate that. Mr. Drew Martin, sir, you're recognized for 3 minutes.
Drew Martin, can you hear me through the mask?
Yes, sir.
I'm here on behalf of the Sierra Club. However, I'm going to comment on my own behalf on this item. I'm not here to oppose or support this item. I simply want to bring up some issues that may relate to your decision today on this item, and that is on water conservation. So while, you know, the gentleman said no one opposes higher rates, but I think we have to look at the fact that rates affect water usage. And so we want the rates to encourage certain types of usage. So for instance, people in low income, we want them to be able to afford water so they can do their daily tasks, cooking, washing their hands, you know, staying healthy. But we want to discourage landscape watering, because landscape with potable water is a real problem. Now, I know not all landscape watering that happens in the county is potable water, but even if people are drawing water out of the superficial well system or out of canals, they are using water that could hypothetically be used for drinking water. And right now, there's a huge drought going on in the Southwest, and a lot of the problem is landscape watering. So when it says in this recommendation that above 6,000 gallons per month can expect to see their bills decrease, the question I would have, and I don't know if anyone is allowed to answer that, will this affect landscape watering and encourage people to overwater? One of my biggest problems is when I see people watering when it's raining. And that is because they don't have a proper irrigation system that's working properly, or people who are overwatering. I know the city of Boynton Beach is trying to reduce the amount of watering, but what I'm saying is that whenever you consider any sort of water costs, those costs should encourage conservation of water and discourage overwatering landscape, particularly in the case of lawns, which are, roughly 60% of our water usage goes to landscape in the county. And if that's water that could be used for other purpose, that's a problem. We are looking at global climate change. We may see more drought in the area. We're seeing some drought right now. The question is, will these rates encourage people to utilize water in a way that will not increase risks of running out of water if we run into a serious drought? Thank you.
Thank you, Mr. Martin, for your comments and your continued commitment to public policy in the county. Commissioner McKinley, you're recognized, ma'am.
Thank you. I have a question for staff that came up. I love that you do these comparisons time and time again. Every presentation we get has a comparison to Miami-Dade County and Broward County. A lot of my constituents want to know how they compare to Hendry County, Glades County, and Okeechobee County when we're talking about industry and rural residents. Any idea how these rates, these new proposed rates, compare to those western counties?
I do not.
And if not, can you get me that information?
Yes, ma'am, we can do that. We can provide you with a pretty substantial list of that, but we don't have that available right now, I'm sorry.
Thank you.
Thank you, Commissioner McKinley. Commissioner Marino, you're recognized.
Is it working? Oh, it is. Okay.
She's back.
I just want to say that of all the emails I received on this, I only received one opposed. Everyone else was for, so I'm happy to vote again to say yes.
Is that a motion?
I make a motion.
Motion by Commissioner Marino. Is there a second? Second by Commissioner Weiss on agenda item 5D1. There's no further public comment or comments by members of the board. All in favor? All opposed? That item passes 7-0.
Thank you.
Thank you very much, and Mr. Jim Stiles, thank you for your leadership on this item and your continued leadership of water utilities.
Thank you, Mayor.
Commissioner Marino, you're recognized. Oh, it's not on.
No, okay. I have to turn it on. You handed this to us the last time you presented, and you handed it to us again today. I hope you're not spending too much money on making all these copies. I would prefer to get everything electronically, and if I choose to print it myself, I'm happy to do that. But if you saw the amount of paper on our at desks here today, we killed a bunch of trees. So Ms. Baker, I think you've heard me say this before. I'd love our presentations to just be online, or if someone's going to print anything, do two slides per page and 2 slides per front, 2 slides per back, and maybe black and white. So this is just a total waste of money. Okay?
I don't think any of us will object to less paper.
Thank you.
Commissioner McKinley, you're recognized.
I'm just going to follow up, commissioners, because this is a change in policy. And so if this board does not want these documents printed out and just to send them electronically, we're more than happy to do it. But I have a mix. And so if this direction is to change, I'd like that direction, because there is a mix.
Well, I mean, I do want to say that I find value in being provided items on the day of the hearing. I don't know that my comment was meant to obliterate that policy, but just to focus on less paper, more efficient printing practices, and Commissioner Marino may want only electronic. Is that too difficult to accommodate? Okay. Clear as mud. Good luck to you. Commissioner McKinley, you're recognized.
Thank you. I know that Ms. Baker, under her comments, has some comments that relate to Mr. Stiles, and I'm wondering if it would be appropriate to reorder the agenda to hear those comments since he's sitting before us right now.
Very good. We'll do a formal motion to reorder the agenda. Do you know the agenda item number, or was it under comments, you said?
It's under staff comments, and Ms.
We'll
Baker.
we'll reorder the agenda, take Ms. Baker's comments on water utility leadership now. Is there a motion? Motion by Commissioner McKinley, second by Commissioner Moreno. All in favor, all opposed? Ms. Baker, you're recognized.
Thank you, Commissioner McKinley, Board. This is Jim Stiles' last day with us. Not last day, his last day is Friday, but this is his last board meeting with us. And Jim has been a visionary, supportive, caring leader for his staff. He has a strong work ethic. No matter what time of night you call him, he answers. And I had, unfortunately, the experience of calling him late at night when we got a problem, and he and his staff are on it immediately. He started his career in water with Pratt Whitney and worked there for a long period of his career before he joined the county in 2007. He was hired as a water utility plant manager for Palm Beach County and moved up to the executive director of the Glades Utility Authority. He was very instrumental in pulling that program in the Glades together when the county worked with them in order to improve the water quality out in the Glades. And then he was promoted to Water Utilities Department as an assistant director and eventually promoted to the director of water utilities in 2014. During that time, Jim's highlight accomplishments over the years have been tremendous. We've seen the number of silos go down in the department talking across divisions, and so and he has held firmly to us being an excellent organization when it comes to water utilities. His vision of Green K expansion phase 2, which will be starting shortly. He will have left us. I was hoping he'd be here when we started the phase 2 project and completed it, but it was his vision for the phase 2. So we're very, very grateful to Jim. He continues to move the department forward as far as staying on the cutting edge of technology and our facilities. So we've got a very robust capital improvement program that Jim helped move along with Kenny, who has also been our finance guy and making sure things are in order. So Jim, we wish you nothing but the best. You have definitely been a valuable asset to this county. I think you leave the department in very good order. You've definitely been one that has looked at diversity, equity, and inclusion in that department. We've come a long way. We will continue to work. And so to you, I bid a farewell. I know your wife has waited for 5 years for you to retire. She finally put her foot down, and Jim is leaving us. Jim is going to become a snowbird, so he's going to have his property here in Palm Beach County that he'll be in during the winter, and he'll be up in the northern part of the country during the summer. So again, I want to thank you and present you with a small token so you never forget that you are part of Team PBC.
Any comments, sir?
Virginia, thank you for those kind words. I appreciate your trust and your support over these last 5 or 6 years we worked together. Todd, you're just the best. I know you're going to get me a lot of support to make the Green K Phase 2 just outstanding. It's going to be world class. I'm excited, and you better all invite me back for the ribbon cutting. It's an honor to be a part of Team PBC under Virginia, and it was an honor to lead Team WUD. We will, under Weissman's leadership, it started. It's always been a great organization, one of the best in the state, but now it's becoming one of the best in the country. And I'm proud of what we've accomplished together, and I hope that I've set it up and left it in good hands, and it'll only get better from here on out. So I want to thank this board for your support. I think you all understood the importance of water, even though infrastructure may not be sexy. It's certainly necessary So I want to thank the board and everyone for your support over the years. Thank you very much.
Thank you, Mr. Stiles. Commissioner McKinley, you're recognized.
I'm gonna call him out, and he's not here to speak on this item today, but he is in the audience. And because of all of the good work that you did in the Glades and GUA and bringing it under the county's umbrella, when I was campaigning the very first time, this man said to me, "Can you do something about our water rates out here in the Glades?" And it's fitting that today you've done that, and that Mayor Steve Wilson from the city of Belglade is here. And so, Mr. Mayor, if it's okay with you, I wanted to give Mayor Wilson an opportunity if he wanted to make some departing remarks to Mr. Stiles.
Mayor Wilson, you always have an open invitation to address this board, and we're honored to have you, sir.
I can see him fidgeting back there, which usually means he wants to say something.
Thank you, Mr. Mayor and Vice Mayor and Commissioners. You know, God work in mysterious ways. I had no idea. I didn't even look at the agenda, only the one that I was concerned about, that Jim, you were retiring. I did not know. So on behalf of the Glades resident, I will tell you, back in the day, if you were running for office for city commission seat back in the day, all you had to mention is that you wanted quality water back during that time. And when Jim took over with the GUA, I would tell you, what an awesome individual. You gave us your word with the support of the county, and you never looked back. So I would tell you, it's fitting that you get to retire with a clean sense of humor you have, but direction that you provided to the residents of the Glades community. God bless you, and he's a jolly good fellow. Thank you so much.
All right, very, very good. Madam Administrator, did you have any appointments you wanted to make at this point, or did you want to wait till later in the agenda?
No, I might as well wrap it up here so that Jim also sees it. As I stated, Jim came in and he's definitely done an excellent job with the staffing over at the utility department and left us with very capable individuals continue this process. So I have selected Mr. Ali Bayat, our current Deputy Director of Water Utilities Department, to replace Mr. Stiles as the Director of Palm Beach County Water Utilities Department. And I request the Board of County Commissioners to ratify my decision on this appointment. Mr. Bayat has been an outstanding employee of WUD. He comes highly recommended by Mr. Stiles, the outgoing director. He started as a project manager, was promoted to Director of Engineering, ultimately rising to the level of Deputy Director. He is a professional engineer and has worked in the capacity as both a Class A certified water and wastewater operator, which is a rare dual certification in the utility industry. And of course, if you ratify it, we look forward to Mr. Bayat leading us forward.
Very good. The administrator has nominated under her executive power Mr. Ali Bayat to be the Director of the Water Utility Department. There is a motion by Vice Mayor Weinroth to ratify that decision. Is there a second? Commissioner Weiss is seconding that motion. All in favor? All opposed? Were there any comments? That motion passes 7-0. Sir, you're recognized in comments, and congratulations. If you don't like public speaking, you might as well get used to it now. All right.
Sure. Well, first and foremost, I'm excited, and at the same time, it's hard for me to see my mentor, Mr. Stiles, after 10 years, is leaving, but absolutely everything been said is true. I work with him side by side for the past 10 years. It's hard for me. But thank you for your support. We wouldn't be here in this place today, such a great utility that we are. And we are going to be the best utility in the nation. We are set for that without your support. I want to say thank you to every single of you. And I also want to thank Ms. Baker for your leadership. We wouldn't be here again without you. You trusted us, you supported us all these years. Thank you so much. And that's all I have to say.
Awesome. Well said. We're delighted to work with you and through the administrator. And congratulations again on this very important position that you now hold.
I appreciate it, Mayor. Thank you.
All right, very good. Thank you, gentlemen, for your presentation today. And let me also thank, while we still have him on the line, the consultant that worked with the county on this. I still see him on the screen. Thank you, sir. You did such a good job, we didn't need you to speak, so well done.
Thank you. I've worked with you guys in the county for several decades, and you're my favorite clients, and this has been a great collaborative effort with your staff on this very important
You say that to all your clients, but thank you very much. All right, Vice Mayor Weinroth, you're recognized.
Thank you, Mayor. I'd like to circle back for a second on the administrative conversation we had a few minutes ago about whether we would have presentations put on the dais for us. Before Commissioner Marino joined us, I had been one of the people to ask to have these put onto the dais, and I certainly share her concern about having a double set of those documents for today's presentation. But I'm going to ask if we could continue, at least for people like myself who've asked to have them, to have those presented. I would also reiterate my thoughts that we're in the 21st century. Can we get rid of the legal size paper and right size these agendas down to something in the 21st century?
Are you
clerk is
trying
recognized.
to, are you giving the county attorney a gift before she leaves?
Get rid
Oh
of
my
the
God, it's
11
been
by
like
12.
10 years
I
I've been
second that.
asking.
I
I'd be so
second that.
happy. Thank you.
I've done a lot of changes, so yes, we can do that.
Thank you, Mayor.
You're going to send Bernhardt into a rage here. He has his little folder process, but we'll work around it. Don't worry. It's well taken. All right, we are off 5D1. We'll move now to 5E1, administration, relating to an ordinance of Palm Beach County Board of County Commissioners reformatting the quorum for advisory boards, which has already been voted on. I think this is second reading.
Mr. Mayor, I'm going to move to approve and adopt 5E1.
Very good. Vice Mayor Weinroth has moved 5E1 forward, seconded by Commissioner Maria Marino. No public comment. All in favor, all opposed. That item passes 7-0. Thank you, Counselor.
6A, we have a part.
We're now on to 6A1, Facilities Development and Operations. We do have public comment on this item, and I will recognize Counsel Ismay for a brief presentation.
Good morning, Mayor, Vice Mayor, and Commissioners. It's Sami Ayala, Director for Facilities Development and Operations. With me here today is Howard Falcon, Assistant County Attorney, and Ms. Purvi Bugaira, Director for Property and Real Estate Management with FDO. This item recommends that the board approves and adopts resolution authorizing the Sixth Amendment to the lease agreement with Theodore Winsber and Gertrude Winsber, extending the term for 6 months to November 1st, 2021, at a rental of $1, and approval of the amendment with Theodore and Gertrude Winsber. In 1996, the county purchased 175 acres from Winsber for the development of the Water Utilities Green Cave Wetlands Water Reclamation Project, with a lease back to the Winsbergs, allowing them to continue to farm the land until the county was ready to construct. The reclamation project was intended to be in phases. With the start of phase 1, the amount of land leased to the Winsberg decreased to 60 acres. The Sixth Amendment extends the lease for an additional 6 months to November 1st, 2021. This will be the last extension supported by Water Utilities Department, since the next phase is envisioned to commence November 1st of this year.
Very good. I don't see any comments from the board at this point in time, so we'll move into public comment, and we'll have an opportunity to make comments or ask questions.
Mr. Mayor, I'd call Mr. Drew Martin.
Mr. Martin, you're recognized for 3 minutes, sir.
I promise not to take the full 3 minutes. I just want to say how much the Sierra Club appreciates the Winsbergs and their generosity in allowing the movement and the development of Green K, and how much we appreciate that facility and look forward to the next phase. Thank you.
Very well said. Thank you, sir. All right, are there any last comments or questions from members of the board, or is there a motion?
Mr. Mayor, I'm going to move to adopt and approve the Sixth Amendment to the lease agreement.
Very good. Vice Mayor Weinroth has moved agenda item 6A1AB forward. Is there a second? Commissioner Bernard has made the second. All in favor? All opposed? That item passes 6-0. We'll move now to 6A2.
Mr. Mayor, I'm going to make a motion to adopt and approve 6 county deeds in favor of the city of Belglade.
I'll
Very good. Is there any
second.
public comment, Commissioner Bernard?
No, Mr. Mayor.
All right, there's a motion by Vice Mayor Weinroth on agenda item 6A2A and B, which is a conveyance of property to the city of Belglade,
I'll second that motion.
seconded by Commissioner McKinley. This requires a majority, supermajority of 5 commissioners. All in favor? All opposed? That item passes 7-0. Very good. Now we're on to 6A3, which is a county deed in favor of the Scripps Research Institute. And I'll recognize, Commissioner Sacks, you recognize, ma'am.
Thank you, Mayor. When it comes to,
Is this related to the agenda item?
this is real, yes, to the
Would you mind just tabling any comments till after the
Absolutely.
presentation? Very good. Ismay, Director of Facilities, is recognized. Can you make sure that the microphone is on?
My apologies. We do have a brief presentation. Okay. Good morning again. This item recommends approval of a county deed in favor of the Scripps Research Institute, conveying approximately 70 acres of the Brigger Tract without reservation of mineral and petroleum rights pursuant to the ground lease agreement between Palm Beach County and Scripps. On February 28, 2006, the board approved an agreement for donation, purchase, and sale of what is commonly referred to as the Brigger site, consisting of approximately 70 acres. Parcel number 1, which is 30 acres, was donated by the seller, and parcel number 2, which is approximately 40 acres, was acquired by the county for $60 million. The seller retained an adjacent 100 acres parcel. Combined, these two properties were envisioned to be part of the biotech cluster. On the Brigger site, approximately 1.6 square feet of biotech uses were expected. On the seller's retained parcel, 2.4 million square feet were expected. On May 2nd of 2006, the board approved the grant agreement with the Scripps Research Institute, which included as an exhibit a ground lease agreement for the Brigger site. On January 24, 2012, the board executed the ground lease agreement. Article 13 of the agreement provides for the conveyance of the Brigger site to Scripps at the expiration of the ground lease agreement, provided Scripps is not in material default. On January 27, 2021, Scripps sent a formal notice exercising its options to purchase the property. The ground lease expired on February 6, 2021. Conveyance must occur within 90 days. The ground lease references the grant agreement as to what constitutes material default. In summary, the ground lease provides that Scripps will be in material default if it vacates, abandons, closes, or relocates operations out of Palm Beach County, if it fails to operate, if it incurs in material default under the FAU sublease, and or is the subject of a bankruptcy-related proceedings or assignments. To staff knowledge, none of these conditions currently exist. With that in mind, let us review the current restrictions on the parcel. The grantor's parcel is restricted for biotech uses as part of the biotech cluster until February 6, 2021. This restriction carries simultaneously to both county parcels. An automatic 5-year extension to the restriction on the grantor's parcel exists, provided that as of February 6, 2021, 50% or more of the grantor's parcel had been purchased, developed, or was in the process of being developed for biotech uses. On February 1st of this year, the representative for the grantor, KG Donald Ross LLC, notified all stakeholders of the extension of the use restriction. Therefore, as a result, parcel number 1 is restricted until 2031, and parcel number 2 is restricted until February 2026. This concludes our presentation, and we will certainly address any questions as you deem appropriate.
Thank you very much. Not seeing any questions yet. I do, okay. Commissioner Weiss, you're recognized.
Thank you. Can you just clarify, my understanding is Palm Beach Gardens contributed $3 million to purchase this parcel? So was the purchase price 16 million or was it 19 million? So the county paid 13 and Palm Beach Gardens paid 3?
Can you make sure your microphone is on, please?
Was there a $3 million contribution from Palm Beach Gardens? That's what was referenced in the video from that meeting.
Commissioner Weiss, can we look that up? Because that may have been on the video, but I don't recall it per se, and give us a chance to research it and get back with you as soon as possible.
Recess?
All right, microphone, please. Hold. Yep.
I was going through my notes, given that is a project with some history, as we all know. So yes, there was a contribution of $3 million to PBC to offset the cost of acquiring parcel number 1.
All right. Are there other presentations to be made, or are we ready for public comment?
No, nothing else.
Very good. Commissioner Bernard, you recognize, sir.
Thank you, Mr. Mayor. We have 2 public comment cards.
I'm sorry to interrupt you, Commissioner Bernard. Commissioner McKinley, you recognized.
Yeah, a clarification on that. So can you go back to the slide that talks about what the purchase price was? So I thought parcel 1 was contributed or donated to us, and parcel 2 is what we paid 16 million for.
That is correct. We did purchase parcel 2.
We purchased parcel 2. Parcel 1,
Was a
the
donation.
slide said it was donated, but actually Palm Beach Gardens paid $3 million towards that parcel 1.
No, my recollection, it was a long time ago, and I apologize. I do recall a contribution from Palm Beach Gardens that would have been towards the $16 million purchase, so we paid $13 million, is my recollection.
Thank you.
All right. Commissioner Bernard, you recognize, sir.
Thank you, Mr. Mayor. We have 2 comment cards. We have Mr. Drew Martin and Reverend William Washington.
Drew Martin, I'm here on behalf of the Sierra Club. I'm speaking primarily on my own behalf, however, on this item. I read the article in the Post, and I really don't think this is a good deal for the county. And I think it really, outlined the fact that this hasn't really created as much as was planned. But more than that, a lot of us, even though, we did not oppose this site, as you know, we opposed the original site at Mecca. But one of the things that concerns me is it's one of the last really nice areas of pines, of these native pines in the county. And when I know a number of environmental groups opposed the removal of the pines on the original site when it was developed. And that site did not go primarily for high tech or biotech. It went for commercial. And now, according to the Post, you're not going to have any restrictions on how this developer might use this site. And it concerns me that you're going to give up an area that originally could have been a park. In fact, the county at one time proposed to buy this area as a park. One of the last really nice stands of these pines, these native pines, and remove these. And, the development they had before was atrocious. It ended up looking like an urban desert, and it originally had been a very beautiful green space. And we think the county should be purchasing areas like this or using them for green space. I think the county has very little open green space with native trees on it that are mature urban forest. And you're going to give this up, we're going to lose this, and you aren't even going to get a guarantee for it. And I really think the county needs to start looking at the environmental resiliency of projects and doing more to protect open space and protect areas where you have this original forest. And when this was developed, the original part, I got all kinds of calls from people up there complaining the look of the new development. They removed the trees, they didn't leave anything behind. It turned into a mud bowl, and I think it affected water quality as well. And as you know, manatees are dying right now because we don't have enough seagrass. And why don't we have enough seagrass? Because we've got this runoff coming from these sites. So you have one site where you have a lot of native slash pines, and if you go through and approve this site is going to be completely destroyed for development, and you don't have any guarantee that this development will do anything of the goal originally to provide biotech. Thank you.
Thank you, Mr. Martin. Vice Mayor Weinroth, you recognize, sir?
Yeah, I was just going to make a comment, and to your comments, Mr. Martin, I think that, hindsight's 20/20, but I think Mecca probably would have been the better selection, and I wasn't here, so I had no input in it. Boca was probably a better location, but I think we are married to the agreement, and so, should there have been a reverter clause? We can all have a debate about that, and there's no tech hub that's been created. But I think we are going to have to adhere to the agreement that was sealed way before any of us showed up on this dais. And unfortunately, this is the agreement that we're going to have to ratify today.
Very good. Thank you, Vice Mayor Weinroth. Commissioner Moreno, you're recognizing questions to the speaker. No, but if you have comments on the agenda item, we can.
We do have one more. We have one more card, so let's.
You recognize Commissioner Bernard.
Mr. Washington.
Commissioner, my name is William Washington, 718 3rd Street. I think the $16 million the county paid, $13 million, whatever the number was. You got $585,000, 585 jobs, which is what you paid for, which was good. It created something. These leaders at that time had, I believe, a vision for compassion for the community of Palm Beach County to do something to help the people of Palm Beach County. And certainly they did whatever they did. I certainly think you should approve it. But I do think that with a windfall like this to Scripps Company, that they should donate a percentage of the value of the land to a black group, nonprofit organization, inconsistent with their vision of compassion for the people of Palm Beach County. And you may say, well, why a black group? Well, I'm reminded of baseball. When the first black player was called to play baseball, there were many people who had talent, black people who had talent. There is an underutilization of black talent. And certainly, if we could carve out, of course, they have no right, no, you have no right to demand that, but we would ask them, I would ask you to ask them, to donate a portion of the land for a black project and use some of this underutilized talent. There's no doubt about it. There are a number of local nonprofits, black groups that have a national reach, that could identify, recruit talented individuals that they could create something, again, with the consistent vision of compassion for the community. These black scientists, if they were recruited, certainly are doing well wherever they are now. They would have to be recruited, and we would have to pay them more than they're making now. But there is talent that can be had, and certainly there are resources. I think Jeb Bush and those leaders who crafted this agreement, we can criticize it, but they knew full well 15 years in the future, this land was going to be worth more than what they were getting for it now. And they were smart enough to have this provision that they could get it at the end of 15 years, knowing full well. And what they have done is create a pool of money. And this is not the end of the story. You may or may not be here, but 15 years from now, somebody else would do something that may be something in the future. We don't know. Certainly, this is money that's well spent. It's money that can be used in the future. And I would urge us to, I'm going to ask myself that they consider with their board approval that they donate a percentage of the value of this land to a black project. Thank you.
Very good. And also just for the board's own knowledge, we do have, we're pleased to have him, Mr. Doug Bingham, the CEO of Scripps Florida here. He has not submitted a comment card, but certainly if he wishes, he can speak, or if you have questions, he has the right to answer them or not answer them. But we thank you for being here today for the presentation. That concludes public comment. We'll go now into comments by the commissioners, and we'll start with the district commissioner, Commissioner Marino. Sorry? Very good. And if, just in terms of formalities and abiding by the rules, if you don't mind filling out a comment card, we would appreciate that, just to keep the record clear.
Okay.
Thank you.
Can I take my mask off?
Yes, sir.
Thank you. Hi, I'm Doug Bingham. Mr. Mayor, Vice Mayor, Commissioners, Virginia, thank you for inviting me to come down and say a few words about Scripps and who we are and what we do, and try to answer whatever questions you may have. I'm Executive Vice President for the Scripps Research Institute. I'm the site head for Scripps Florida. I live here. I work in this community. I love this community. 17 years ago, I was part of the team that negotiated with the state and with the County of Palm Beach, and I'm very proud of the decision to choose to move to Palm Beach. I think we've accomplished a lot here. When we first showed up and started recruiting scientists from across the country, there was a lot of questions about the quality of the schools, the quality of the infrastructure. Where's my kid going to get a job in Florida? And I got to tell you, we were still recruiting top-ranked scientists today. We don't get those questions anymore. I think this county should be proud of how it's evolved over the past 17 years. The schools are much better. The opportunities for your children in the county are much better. When we first started talking to Palm Beach, the FAU did not have a medical school. We helped make that happen. You know, we've done amazing science on our campus. That's what we do. We're a nonprofit ourselves. We're a not-for-profit research institute. Our mission is to do basic science, to discover new treatments, new cares, to help solve unmet medical needs. Also to train and educate young scientists. We have a very robust internship program. I think we've had over 1,800 Palm Beach County students of high school and from FAU come through our campus over the past 10 years. We have a very, what we think is a very robust outreach program to the undeserved populations of Palm Beach County. We've had students come through, African-American student come through and intern at a lab at Scripps and go on to Columbia University and get a PhD. So we're very proud of that outreach program. If any of you have had the COVID vaccine, I heard there was a presentation on it earlier today. If you've had the Moderna or the Pfizer vaccine, you have Scripps Research technology in your system. You know, that vaccine depends on our inventions we made relating to the COVID virus. We have top-ranked, some of the top-ranked national, experts on COVID at this campus in Florida. We could talk about this. I can talk about the vaccine all day long if you want. If you want technical, you don't want. Okay. In any event, we've worked. It's been a team effort between the state, the county, the BDB, FAU, to create momentum in this county. To help move the innovation or the knowledge economy forward. We believe there's momentum now. We see lots of activity, and we're excited about that. We ourselves have spun out one company a year locally. So, at this point, I just can't thank you enough. It's been a pleasure and a privilege to be down here and work in this community.
All right, did that conclude your comments?
That does.
Very good, thank you. There may be some commissioners that have comments or questions. Did you want to ask any questions of this? She has 3 microphones now.
Does this one work?
Voter.
Yay! Okay. As the Commissioner for District 1, Maria Marino, I'm happy to welcome Doug here. As a matter of fact, Doug and I chatted on the phone this morning just for a little bit of history. But I do want to let everybody know that even though Scripps has this property right now the way it does, it actually has been paying the non-ad valorem taxes on this property to the tune of close to $800,000 a year. So it's not like they have the property with no expenses whatsoever. So they have been, for the last 15 years, paying the non-ad valorem taxes on this property. Scripps has done stuff in the past to try to bring partners to that land, and obviously things have fallen through, and before the certificate of need went away, there was an opportunity for a hospital, but because the certificate of need was still in place, that was turned down. I do know that they do a lecture series. They've partnered with the community. There's been technology. The Carrier building that is in that same vicinity right there on the Gardens property is technology. And I know we talk about bioscience, but we also need to understand that technology is what supports bioscience. So there should be a pivot to technology on that property if possible. And we do have Max Planck there, and we do have a partnership with FAU. So though it might not seem that bioscience has developed as much as we would have liked it, there is a huge synergy going on right there. Now, having said all that, they should have been on Mecca. I'm not going to go back to that discussion. That land was so less expensive than what it is in Jupiter right now. And when land is as expensive as it is, to bring the little incubator companies here to experiment, it's very costly for them on this land. It's just not viable for them. They needed inexpensive land, and this is not it. But it is the contract says what it says, and having talked to our attorney and hearing everything, all of the background information, it is for us to turn this land over at this time. But it is going to be another 5 years that Scripps has an opportunity to put bioscience in there, and that was triggered by the sale of Coulter to the hospital 5 days before February 1st. So that's why the extension, another 5 years as opposed to tomorrow. So there is another 5 years for us to research, and for Scripps to research and find some bioscience that will go in there and partners that can fulfill that. So, Doug, did I miss anything?
No, we've worked hard with the BDB to get opportunities out there for a variety of reasons that haven't worked out. We've also put about $2 million in improvements into that land. That's not a trivial thing, in addition to paying the ad valorem taxes. So, and that piece of land was critical. We relied on the presence of that land when we made the decision to come here. It's what set the Palm Beach County offers, set it apart from the offers we had in other counties and other locations. So that piece of land is what really set you apart, and as well as a beautiful climate. But
true, and as we said, you did fulfill the requirement of jobs, and it did bring Max Planck here and the partnership with FAU. So there has been a lot that has happened because of Scripps being in the location that it is. Thank you.
Very good, and I'd just like to, we have other comments by commissioners, but if I could respond to the district commissioner, who I give great deference to, we all understand that we weren't here when this deal was made. I certainly have every intention of honoring the contractual obligations of the county in my one vote. However, just because of the nature of the transfer and really the government monies and taxpayer monies that have been put into the purchase of it initially, my inclination is to table this for 30 days so that I can do some due diligence on the contractual obligations that had to be met, that I haven't been briefed on to the extent that makes me feel comfortable in terms of aspirational goals. Whether those can be determined by a court of law or not, I don't know. But I feel a little bit uncertain as I sit here right now, and I'd like to do my own due diligence in terms of whether there was, as you said, a material breach or default or not. So that's where I'm at. I wanted to respond directly to your comments because of the deference we give the commissioner of the district. We'll move now to Commissioner McKinley and then to Commissioner Bernard.
Thank you. I don't know, Doug. I've been to La Jolla a couple of times. The climate there is pretty nice, too. Yeah, Todd was with me. What sort of recruitment efforts are you making? I've been sitting on the business development board for 5 years, so I'm pretty well schooled in the recruitment efforts that the BDB makes, and they're pretty aggressive. And there always seems to be somebody looking at something for some biotech or technology purpose. And yet here we've got this property that nobody has an interest in. And so who's handling your recruitment efforts for that property?
Well, over the years, it's changed. We've gone so far as to even hire a CBRE to help us try to find clients for it. So that was in 2016. So it's not like we have not tried. Part of the issues have been the nature of the restrictions, the nature of the lease. It's not a financeable lease. And so there's just been, and plus there's been a lot of, there have been recruitments to the area. We managed to get the Max Planck to come here. Okay, that was good. There's been a lot of cheap land still around that, Beacon Pharmaceuticals was made a wonderful deal by the city of Jupiter. We were deep into discussions with them. So it wasn't just about price of the land, there was also incentives involved. So, you do your best. The whole attempt to build a medical research campus with Tenet ran into the CON problem. That would have been wonderful. We're still hoping to do something like that someday. We've had everywhere from Ayurvedic medicine retreats to you name it. People come talk to us. We're very interested in somebody who's going to bring something strategically important to the Institute and its mission. Our mission is basic science, meeting unmet medical needs, biotechnology. That's what we're interested in. That's what we've been trying to do.
Well, the legislature certainly made your certificate of need issue pretty much go away. So have you started to re-engage in those conversations?
Well, I don't want sure, we're very much aware of what the new opportunities, I think UHS has purchased a piece of property directly across from ours, and they are submitted a proposal to the city of Palm Beach Gardens to have a hospital built there. And so that's given other hospital systems, other potential medical partners pause. And so I think some of them are trying to work on those issues. Certainly, I guess that's all I can really say about that at this point.
And can somebody on staff tell me what this property is valued at today?
Currently, we don't have a current appraisal that has been done, but vacant land typically does go from anywhere to $700,000 to $1 million an acre. The assessed value is a little over $340,000 an acre.
Okay. So you're asking us to transfer an asset and we don't know the value of it?
The transfer of the asset would be pursuant to the contractual obligations of the agreement, so.
I understand, but when I explain to my constituents, oh, it's, the contractual obligation of the county, they're going to ask me what it's worth, and nobody can tell me what it's worth today.
By means of an appraisal, no, it's certainly information we could gather if so instruct.
Which speaks, Commissioner McKinley, to the pause and due diligence that I would like to accomplish in the next 30 days.
I was not in favor of that originally, but I would like to know, and obviously we're going to hold up our end of the bargain, but I would feel far more comfortable knowing what this property is valued at before we just vote on this. I would think the property appraiser could give us some sort of value on that.
If it's helpful, the transaction that just occurred on February 1st was for $1 million an acre.
Okay, so roundabout, we're handing over a $40 million asset that we spent $16 million of taxpayer dollars on. Scripps, certainly a beneficial asset to have in our community, no argument there. And I wasn't on the board either, even though I'm the longest one here. I wasn't a part of that decision either. And so we're kind of handed what the previous boards have given us. But you are a nonprofit, Doug, so you now have a $40 million asset in your hands. And so to Mr. Washington's point,
it's not worth $40 million. It's got the restrictions on it. I will tell you that right now. You can go get it appraised. Believe me.
my question was, in order to remain a nonprofit on that, what are the legal obligations for that? How does that work with a nonprofit holding on to that property?
These are all questions that I need answered before I can defend myself to my constituents.
Okay. Unfortunately, because staff can't answer the questions today, I make a motion to table this item until our next regularly scheduled Board of County Commission meeting.
The motion to table will be pending. Is there a second? Second. All right, second by Commissioner Sacks. The motion is on the table, to table, but we still have comments from members of the board, so we'll turn now to Commissioner Bernard, and then to Commissioner, oh, everyone turn their light off.
Thank you very much, Mr. Mayor. If we're going, since I do support tabling the item and also, to give us enough time, I do believe that, Commissioner McKinley, you sit on the BDB, and, the BDB works hard to, bring businesses to Palm Beach County. And I think that we need to get a detailed proposal, plan, or action item from Scripps to detail to us exactly the efforts that they've made, during those years before we can vote on this item. I think that this item that's in front of us, to me, it's one of the most awful, atrocious, and ridiculous items that I've ever had to vote on. If an item that we purchased for, $16 million and whatever it's valued at, I think we need more information, and this is not something that we can rush. This was the taxpayers' dollars. A lot of money was spent on this to bring Scripps here, and we just cannot give away a property just like that without getting more information. And it's not county staff who's supposed to present all this information to us. Scripps, they have a duty to tell us exactly, did they meet those obligations and did they make the best effort? So that's my statement. Thank you.
Very good. Thank you, Commissioner Bernard. Commissioner Sacks, you're recognized in comments.
Thank you so much, Mayor. I concur with my colleagues, and I'm relatively new on the board, but I absolutely concur that I can't possibly make a decision without more information being presented. I owe it to the taxpayers of this county on their investment, regardless of how many years ago it was. I just need to have more information. I have no information I've got a lot of paper and a lot of stuff, but I don't have any paper on this. And I will not vote on the use of taxpayer money, no matter how many years ago it was, as a representative of the taxpayers today to vote on something that I have no information on. So I absolutely, Mayor, concur with Commissioners McKinley and Commissioner Bernard and yourself on giving us more time so we have facts before we can vote on this issue.
Very good. And you were the seconder of the motion, Commissioner Sacks? Yes. Just trying to keep my notes in order. Are there any further comments from members of the board? Motion is to table this item, made by Commissioner McKinley and seconded by Commissioner Sacks. Was there a specific date that you wanted this brought back by?
Next meeting, she said.
Next meeting?
Mr. Mayor, I feel pretty comfortable that staff can get us the information we're requesting by our May 4th meeting.
So
I
just,
don't think we've asked for anything too extraordinary.
just
Can't hear
the
you,
normal agenda
Commissioner.
process then? I'm sorry.
We can't hear.
I feel pretty confident that staff can get answers to our questions by our next meeting, which is May 4th.
All right, the
May
motion by Commissioner McKinley and seconded by Commissioner Sacks is to table this to the May 4th meeting.
I would, if I may, I don't know if
Please.
I may say something on this, but the county staff needs to give us some answers. But also, I'd like to hear from Scripps in terms of any information they may have to present. And I would imagine that they could do that before that date on our board meeting in early May. And if they can, I think that's very important for us to get the information. And so I would second that. Thank you.
Okay, and I'll just say, just to bring some clarity to this, they have no contractual obligation to speak with us, to provide us anything, so I intend to do my own personal investigation, reach out to the BDB, try to interface with Scripps, try to find other people with historical knowledge and institutional knowledge on this timeframe. I remain committed to honoring any contractual obligations that the county may have, but at this time, I think there's a consensus that hasn't been met. So the motion's been made by Commissioner McKinley, seconded by Commissioner Sacks, to table this item to the May 4th board meeting. No further comments? All in favor? All opposed? Vice Mayor Weinroth dissents. It passes 6-1. Thank you, sir, for your appearance here today, and we look forward to continuing the conversation on May 4th. All right, we're now on 6B1, Housing and Economic Sustainability. A staff recommended motion to conceptually approve a neighborhood stabilization program, NSP1. Is there a presentation on this item?
Commissioner McKinley, is the mayor here to speak on this item? Commissioner McKinley?
Sorry, I got distracted there for a second. I think we have one speaker
I didn't hear that,
on this item. Do we have a speaker on this item?
but the mayor is here, so.
Oh, that mayor. I thought you were talking about me. I'm trying to figure out. Mayor, can we invite you back up, sir?
He's like Alcee Hastings. I hate following him, but I'll let him go first.
You recognize in perpetuity, sir.
Thank you, Mr. Mayor. I'm here just in support of this request, and I hope that you guys understand the need of this NPS 1 funding request. Our fearless leader, Commissioner McKinley, has been working on this with the staff to make sure. You guys know that the county on school board district approved this last year sometime to donate that property to the city of Belgrade. But we've been having the most difficult time getting a interested developer because of the cost of the demolition. So what you have before you, if you guys would kindly understand the need of supporting this request, it will help us to get a developer out there to get workforce housing, which is clearly needed, not only in Palm Beach County, but particularly the Glades, Belgrade. And thank you guys so much.
Thank you, Mayor. There's no public comments. I'll recognize the District Commissioner for motion.
I have nothing further to add to those wonderful comments, just to ask my board to support this. The city of Belgrade has made some wonderful efforts of trying to put out RFPs and get responses, and we're simply not getting the responses because of the extraordinary cost of demolition on this site. This is mutually beneficial to the city and to the county, and most importantly, to the residents who need safe, clean housing in the Glades. So with that, I will move approval of item 6B1.
Commissioner McKinley has moved agenda item 6B1 forward, seconded by Vice Mayor Weinroth. No further comments. All in favor? All opposed? 6B1 passes 7-0. Thank you, Mayor, for your time here today.
Can I make one quick comment, Mr. Mayor?
Sir.
It's off topic, but I want to say to all of you, I know all of you, I've been around a long time. I feel like I'm a dinosaur now, but you guys are doing an awesome job. I'm not saying it because you did us a favor here today, but I'm saying it from my heart. I've been around and I've seen, commissioners after commissioner. You work hard together under some tough times, but I see how you guys really work together. Don't always agree, but at the end of the day, you end up making it happen for the people of Palm Beach County, which is one of the fastest growing counties in the state, if not the country. I'm really impressed with the way y'all work together under tough time. God bless you all. Thank you.
Thank you, Mayor, for those very kind comments. All right, that concludes the regular agenda and public hearings. We'll move now to 7A, which are commission district appointments. We'll start with District 1, Commissioner Marino. None. District 2, Commissioner Weiss.
Yes, I'd like to appoint Ms. Sarah Pardue to the Planning Commission.
Motion by Commissioner Weiss, seconded by Vice Mayor Weinroth. All in favor, all opposed. That appointment passes 7-0. Any further appointments, sir?
No, sir.
District 3, I have none. District 4, Vice Mayor Weinroth.
I have none.
District 5, Commissioner Sacks.
Thank you, Mayor. I'd like to appoint Cheryl Budd to the Boca Raton Airport Authority, and this would be a reappointment.
Very good. Motion by Commissioner Sacks, seconded by Commissioner Bernard. All in favor, all opposed. That reappointment passes 7-0. Any further appointments, ma'am? Commissioner of District 6, Commissioner McKinley.
I have no appointments.
District 7, Commissioner Bernard.
I have none, Mr. Mayor.
Very good. That concludes agenda item 7A. We'll move now to 8A, administration comments, which should be substantially shorter than previously advertised at this point.
And I'm looking for just a tad bit of clarification on the scripts and the appraisal. Does this board want us to go out and have an appraisal conducted because those are additional dollars, or is it sufficient to work with the property appraiser and come up with an estimate? Okay, thank you.
Speaking for myself, I don't want any more taxpayer funds spent on this parcel. I don't think an appraisal or not changes the contractual obligations in terms of whether they were met or not. So I intend to do my own personal evaluation of whether the contract has been breached or in default or not. So I'm not asking for default. Is there any, an appraisal? Is there any commissioner that would like that? Clarity obtained? Very good. Further comments, ma'am? Awesome. 8B, County Attorney Denise Neiman.
I just have to repeat my enthusiasm for that non-legal size paper, so thank you again for that. And I know that just drives every administrator crazy with that comment, but I love it. Thank you.
The Vice Mayor is full of great ideas, I trust. Any further comments? All right, we'll move now into agenda item 9, Commissioner comments. We'll start with District 1. Commissioner Marino is recognized.
Okay, hopefully I have a microphone that works. Yay. I would like to request an off-site proclamation declaring May 2021 as Internal Audit Awareness Month in Palm Beach County.
It's exciting.
And you can do them all at one time if
And
you'd like.
I have a request for an off-site proclamation honoring the 20th anniversary of the Place of Hope. And I know the Place of Hope has but has been a force in all of our cities, municipalities, and the county. So I am happy to do that.
Second.
A motion by Commissioner Marino for 2 off-site proclamations, seconded by Vice Mayor Weinroth. All in favor, all opposed. That passes 7-0. Further comments, ma'am?
I do want to say that you all know about the Edna W. Runner Tutorial Center, and the County Commission has supported their efforts over and over and over again. And I do know that they are having an Earth Day event as a fundraiser on Thursday, April 22nd. I don't know if I'm out of order for saying that, but I will be attending, and I would encourage all of you, if you want to get to know Edna better and the facility, something that you've supported in the past, I'd encourage everybody to come, and if you're interested, please reach out to me.
Awesome. Thank you for the invitation. Certainly not out of order. Does that conclude your comments, ma'am? All right. District 2, Commissioner Greg K. Weiss.
Thank you, sir. I'd like to request an off-site proclamation declaring May 2021 as Mental Health Awareness and Trauma-Informed Care Month in Palm Beach County.
Motion by Commissioner Weiss for off-site proclamation, seconded by Vice Mayor Weinroth. All in favor? All opposed? That passes 7-0. Further comments, sir?
No, sir.
Very good. We'll move now to District 5, Commissioner Maria Sachs.
Thank you, Mayor. I'd like to request for an off-site proclamation declaring April 26, 2021 as Community Education Exchange Day in Palm Beach County.
Second.
Motion
And
by
then, yeah, I have
Commissioner-
another one, but we'll do one at a
Yeah,
time.
do them all as a slate if you don't mind.
Okay, no, I'm going to do the other one then. Thanks, Mr. White. This is a request for an off-site proclamation declaring April 26th to the 30th, 2021 as Dr. Malcolm Dorman Remembrance Week in Palm Beach County.
Very good. Motion by Commissioner Sachs and seconded by Commissioner Weiss for 2 off-site proclamations. All in favor, all opposed. That item passes 7-0. Further comments?
And the one other further comment is that I'm going to be, I would like to initiate an economic and technical summit for early this fall to boost our economy and to showcase what an amazing economic engine Palm Beach County is. So I'd like to formally request to be the liaison to represent the County Commission on this summit and to work with our administrative staff to begin the process. I'd also like to request that every commissioner work with me to promote something in their district that is of particular note, either 1 or 2 or 3 things that will boost our economy post-COVID. I think we're ready to turn the page and move on to economic development in this amazing county of ours.
Well, turning the page aside, I think we're all ready to start focusing on that chapter. I don't think we're ready to abandon any efforts to land this airplane as we discussed earlier, but are there comments by other commissioners on this request? It's certainly at the forefront of our thoughts and concerns. I think you'd be an excellent ambassador. I do know that we have Commissioner McKinley on the Business Development Board, so I would suspect that there would have to be much participation by her and her board that are you the chair of the BDB? Or at least the county representative? But I have no objection. I don't see any other direction from members of the board.
Mr. Mayor, it's going to be a concerted effort by all of us. And my staff is just going to be doing most of the work forward on it.
Can't argue with
This will
that.
be something by the entire board, and it won't be until the fall, till we're past this situation that we are with COVID. But I would like to start planning for it now, Mr. Mayor.
Madam Administrator, do you have any concerns, or is this something that can be accommodated at the commissioner's request?
It'll work for the board.
All right,
Thanks for the direction.
very good. Any further comments, ma'am?
No, Mr. Mayor.
All right, we'll turn now to District 6, Commissioner Melissa McKinley.
Thank you. And Commissioner Sachs, that will be fun. The Florida Association of Counties is hosting the Innovation and Policy Conference in Palm Beach Gardens in mid-September, and so we can jump off of that and do what you're asking to do, and I think that's a great idea. I first have a request for an off-site proclamation recognizing the 80th anniversary of the Junior League of the Palm Beaches. I can't believe it's already 80 years.
Motion by Commissioner McKinley for off-site proclamation, seconded by Vice Mayor Weinroth. All in favor, all opposed, that passes 7-0.
Thank you. I'd also like to duly note that I'm not the only Junior League of the Palm Beaches member. I do have a former member sitting next to me in Commissioner Marino, so I hope Commissioner Abrams is watching that here. How many times we've said Junior League in this conference. And then I just want to compliment Sean Hall. Sean is our legislative liaison in Palm Tran, and Todd and I were supposed to head up to Tallahassee on Friday when they suddenly announced budget conference, and 3 of you know what that means. You don't get much warning when that happens. And because of some family emergencies, Sean had to go in our place, and he has been up there working around the clock all weekend, texting me right now updates on who I need to contact on some of our appropriation requests. But just want to thank him for grabbing a suitcase and running up there to make sure that somebody was coordinating with our lobby team on all of our asks this year. So thank you, Todd, for sending Sean up there on our behalf.
Thank you, Commissioner McKinley, and I know I speak on behalf of the board when I say thank you for all of your work in representing the Board of County Commissioners and all 67 counties and the time you spend up in Tallahassee. If we can ever be of assistance to you, you know how to find us, but we love that you take that on. Commissioner Sacks, do you have comments to Commissioner McKinley?
Yes, I do. I just wanted to thank Commissioner McKinley for being up there and fighting the good fight. It's extremely difficult now to navigate the process in Tallahassee. And you are doing an amazing job. I'm hearing from many of the folks up there in Tallahassee and our lobbying board under Todd Von Laren, but especially having you there has made a big difference in what we can expect to bring down home from the state capitol. So thank you very much for representing us, and thank you, Mr. Todd Von Laren, for doing all that you have been doing. Thank you.
And they're doing a heck of a job because I hear good news from Tallahassee and from Todd on a regular basis, so keep up the great work. All right, no further comments? Very good. We'll move now to District 7, Commissioner McBernard.
Thank you, Mr. Mayor. Just want to thank Sean Hall, as you mentioned, Commissioner McKinley. I'm just disappointed y'all gave him enough time to grab his suitcase. But, you know, I know he's doing a great job.
Very good. Thank you, Commissioner Bernard. We'll move now to the Vice Mayor, Vice Mayor Robert S. Weinroth.
Why, thank you, not Weiner, Weinroth. Yes, on behalf of the mayor, I'm going to request several off-site proclamations declaring May 2nd through 8th as National Correctional Officers and Employees Week in Palm Beach County, and a proclamation declaring May 15th National Peace Officers Day in Palm Beach County, and April 20th as Palm Beach County Sheriff Office Volunteer Day in Palm Beach County.
Vice Mayor, would you mind adding to that, declaring a proclamation off-site April 28th, 2021 on Palm Beach County Workers' Memorial Day?
It would be my pleasure, Mayor.
Thank you.
May I have a second?
All right, thank you for that motion. The motion's been made by Vice Mayor Weinroth for 4 off-site proclamations for Commissioner Dave Kerner, seconded by Commissioner Sacks. All in favor, all opposed, that item passes 7-0. Further comments, sir?
Thank you, Mayor. And I'm going to ask for one off-site proclamation on my own behalf. That's for May 2021 as Building Safety Month.
Motion by Vice Mayor Weinroth for off-site proclamation, seconded by Commissioner Weiss. All in favor, all opposed, that passes 7-0. Further comments, sir?
Thank you, Mayor. Yeah, we discussed probably a little bit too long the issue of the virus and vaccinations. I see that Jackson Health System has now suspended appointments, and it's all going to be walk-ins going forward. I think that notwithstanding the fact that the county does not control the healthcare district or the Department of Health, I think we need to work with our partners to do anything possible to remove any impediments to people to getting the vaccine. And I reiterate the need to do what we can to inspire our residents to embrace the vaccines. If that means putting a carrot out there, and I know with our employee health program, our wellness program, we have a carrot. I know with the flu vaccine, a lot of the places like CVS and other do a $10 gift card to get people to come out and get the vaccination. So I would challenge our incident commander to work with our partners and see if we can't put a program together in addition to the PSAs. I think that we really have an obligation as a board to make sure that more of our residents are embracing the vaccine so we can get this herd immunity finally behind us and put these masks with our hula hoops and move on. So that being said, I'm done, Mayor.
Very good. Thank you, Vice Mayor. Madam Administrator, is the challenge accepted? Of course it is. Wonderful. My comments, I have none. Thank you for a wonderful day of local government. The Board of County Commissioners is adjourned.